Good morning, and it's my pleasure to welcome you to the August meeting of the California Board of Psychology. Before beginning, I would like to thank our partners at Solid for facilitating today's meeting, and I will turn it over to our moderator to provide an overview of the functionality of WebEx. Madam Moderator?
Thank you. This is the moderator. Before we get started, I would like to remind board members and all panelists, so staff, who are not speaking to please mute their microphone if background noise is detected during the meeting as a result of unmuted microphones. I will either provide a brief reminder or simply mute microphones as to not interrupt the meeting. There are members of the public in the audience and meeting minutes are being taken, so I ask board members and staff to please identify themselves before speaking. To facilitate public comment, we will be utilizing the WebEx question and answer or Q&A feature. When the board president reaches a point in the agenda which public comment is appropriate, public comment will be requested. And at the board's direction, I will turn on and announce the opening of the Q&A feature. Members of the public can indicate they would like to make a comment by clicking on the Q&A icon located at the bottom right corner of their WebEx screen. These instructions will be shared on the screen each time for your reference, and they're currently on the screen for you to reference. In the Ask field, typically located at the bottom right corner of your WebEx screen, members of the public who wish to make a public comment will type, "I would like to make a public comment," and send it to all panelists. Members of the public, it is not necessary to identify yourselves in order to make a public comment. I will call on the request as in the order that they are received. I will call on the member of the public who submits a request to unmute their microphone. When prompted, member of the public will need to click the Unmute Me button to be able to be heard. Please note that the Q&A feature is being used only as a means for the members of the public to represent that they would like to make a verbal comment. Once unmuted, the member of the public may verbally state their comment. If any attendees utilize a profane name, they will not be called upon to prevent members of the public from being subjected to profane language. While you are free to express criticism for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. And please note that the hand-raising feature is being used by board members and staff to facilitate discussion. Members of the public, please use the Q&A feature to submit your request. Thank you, and I pass it back to Board President Fu.
Thank you so much, Madam Moderator. And I would like to call to order to establish quorum the board's August 27th meeting. Ms. Berteau, could you please call the roll?
Yes, thank you. Kasuga. Oh, that's right. She's Cervantes.
Here.
Fu.
Here.
Harb Sheets.
Here.
Nystrom.
Here.
Phillips.
Here.
Riscate.
Here.
Rogers.
Here.
Tate.
Here.
Roll is complete.
Thank you. A quorum being established. So we will now move on to item number 2, the President's welcome. First off, I would like to say that today's board meeting, as you can tell, is being held by a WebEx, and this is pursuant to the provisions of Governor Gavin Newsom's Executive Order N0821, dated June 11, 2021. Neither board member locations nor a public meeting location are provided. Public participation may be through the WebEx link as provided and as covered by our Madam Moderator. And if you have trouble getting onto the call to listen or to participate, please do call 916-574-7720. That's 916-574-7720. And with that, the Board of Psychology protects consumers of psychological services by licensing psychologists, regulating the practice of psychology, and supporting the evolution of the profession. We have 2 announcements today for this item. The first is related to Ms. Helen Joffrey. Ms. Joffrey will be joining us as our board counsel today. Ms. Joffrey, would you like to say any words?
No thanks, but thank you for pronouncing my name correctly. I do appreciate that, and I'm happy to assist the board when needed.
Thank you so much, Ms. Joffrey. The second is with regard to our November meeting. Our intention has been to have our November meeting be held in person in Sacramento. At this time, we are open to the possibility that it may be held virtually due to the continued pandemic and the surges that the state is experiencing right now with regard to the Delta variant. So in terms of plotting next steps, we endeavor to do this in person as long as it's safe to do so and in accordance with the public health orders for Sacramento County. But I do want to share that we are right now preparing for the possibility that November might be a virtual meeting as well due to the ongoing surge. Board members, are there any questions with regard to the November meeting update that I just shared? All right, seeing none, we'll take up item 3. So item 3 is for public comment on items not on the agenda. And so before I invite the speakers to come forward, I just would ask that individuals making comments not discuss the specifics, including names as to pending complaints, pending licensing applications, or pending disciplinary actions that may come before the board for a decision. Such decisions are considered ex parte communications as they could provide information to the members that is outside of the record in violation of the Administrative Procedure Act. Therefore, such discussions may create a conflict and interfere with the board's capacity to make necessary determinations. Board staff is available to speak to you individually and answer your questions outside of the hearing of board members. The board is eager to listen attentively to your comments. And while there may be a desire to engage in further discussion with comments presented during this time, the board may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda for a future meeting. Although this may give the impression we're not being responsive, these procedures are critical to ensuring the compliance with the Open Meetings Act and to avoid compromising the speaker's goals or the board's mission. So with that, Madam Moderator, could you please start our public comment section for item number 3, please?
Yes, this is the moderator. I've opened up the Q&A. Members of the public, if you would like to participate, click on the Q&A icon that is located at the bottom right corner of your WebEx screen. And in the Ask field, type, I would like to make a public comment, and click Send to all panelists. So I'll pause for a moment to allow members of the public time to access the Q&A feature.
Madam Moderator, not seeing any participants submitting their indication that they're speaking, we can go ahead and close public comment.
Thank you. Closed.
Thank you so much. All right, now we're going to go ahead and move to item number 4, discussion and possible approval of the board meeting minutes for May 21st, 2021. Board members and attendees, this is in our hand carry section of our board packet for these items. Is there a motion to approve the board meeting minutes from May?
So move. This is Dr. Tate.
I have a motion by Dr. Tate. Is there a second?
This is Ms. Nystrom, and I second.
Excellent. Board members, do you have any comments or discussion on the board meeting minutes? All All right, I'm not seeing any raised hands or unmuted microphones, and I think this may be the first time we're adopting this minutes without amendments. I'm very excited about this possibility. So if there aren't any if there isn't any board discussion, Madam Moderator, could you please open for public comment?
Yes, thank you. This is the moderator. The Q&A is now open. Members of the public, the instructions are on the screen. Click the Q&A icon, type, "I would like to make a comment," and send it to all panelists. No requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. Thank you so much, Madam Moderator. All right, so let's bring this back to the board. Are there further discussions as it relates to our board meeting minutes? For item number 4? All right, not seeing board discussion. Ms. Berteau, could you please call the roll?
Cervantes,
Aye.
Fu,
Aye.
Harb Sheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
All right, that motion carries. Let's go ahead and move to item number 5, the Executive Officer's Report. Ms. Sorick.
Good morning, board members. Included in your meeting materials is the Executive Officer's Report. And I have included the vacancy information for the board. And one update to that, you'll hear a little bit about that later, but we have one less vacancy to report. So we have a Central Services Technician vacancy in the Central Services Division, and then the Legislative and Regulatory Analyst vacancy that was recently vacated by Ms. Rivera. So those 2 vacancies are current for the board. And then I have included the latest waiver update, and there's no movement on the waivers as of right now. There are a couple that expire on the 31st of August, and we have not heard about extensions to those waivers. And I'm available for any questions the board may have.
Thank you, Ms. Sorick. One of the items I just want to point out with regard to the waivers is that the board is recognizing the different and varying local ordinances and public health orders that is affecting in-person, face-to-face. And so I just would like to take the time and recognize and acknowledge that that continues to be an evolving situation that is affecting the board licensees. And so the board has provided flexibility until January 1st, 2022 with regard to the changing local health ordinances and to being responsive to stakeholder input in terms of these waivers. I know we'll discuss this more, but Ms. Orr, can you share a little bit more about the flexibility that the board's providing?
Yes, typically what we've been experiencing with the waivers is that they are renewed for 2 to 3 months at a time. And in order to provide some sense of predictability with the face-to-face supervision waiver, and since at the federal level, the HIPAA compliant technology is still an acceptable means of providing not just service, but also secure interaction. We have extended that waiver to the January 1, 2022 timeline, just to give people some more time to be able to plan for that. And as it gets closer to that timeline, we'll be able to talk about that probably at our November meeting and see where we're at with the different local health ordinances and the different variants that are happening at that time. So our hope and plan is to give people the most time we can to be reasonable and predictable in unpredictable times.
Thank you, Ms. Sorick. Board members, are there any questions for Ms. Sorick with regard to the executive officer's report? All right, I'm not seeing any raised hands or unmuted mics, so I'm going to ask that Madam Moderator please open up for public comment.
Thank you. This is the moderator. The Q&A is now open. The instructions are on the screen. Simply click on the Q&A icon located at the bottom right corner of your WebEx screen. Type comment or I would like to make a comment and send to all panelists. Board President, no requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. Thank you so much.
Thank you.
All right, not seeing any further board discussion on the executive officer's report, we're going to go ahead to item number 6. It's my pleasure to welcome Brianna Miller with the Department of Consumer Affairs and specifically with the Bureau of Board Relations. Board and Bureau Relations, excuse me. So Ms. Miller, welcome to the board.
Hello, good morning. Can you hear me all right?
Yes, we can. Thank you.
Wonderful. Thank you. Well, then I will get started. Good morning, Board President and board members. I'm Brianna Miller with Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me the opportunity to provide a department update. I'd like to start out by discussing remote meetings, which President Fu, you did touch on a little bit this morning, so hopefully this helps add to the discussion. DCA is receiving many questions about when and how boards will meet again in person and whether they can also continue to meet remotely. As the law and executive orders stand today, after September 30th, all boards and committees will be required to return to in-person meetings with publicly noticed meeting locations. However, due to ongoing changes in the COVID-19 pandemic, it may happen that the ability to meet remotely will be extended in some capacity. We do not have any concrete news to share today, but certainly DCA will do all it can to assist boards and bureaus to plan safely for in-person meetings, and we will keep you informed of any changes to meeting requirements as they come about. Moving on to COVID-19 safety measures. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination or they will be subject to regular COVID-19 testing and will be required to wear appropriate PPE. Board members and committee members are considered employees and must follow these health and safety protocols if they plan to be physically present in a DCA location, whether it be for a board meeting or just a quick visit. Members must verify vaccination or follow face covering and testing protocols in accordance with that location's requirements. Statewide guidance for the use of face coverings from the California Department of Public Health remains in place unless a local health jurisdiction issues a stricter public health ordinance tailored for the situation in their communities. Many counties have revised health orders requiring face masks to be worn by both vaccinated and unvaccinated individuals while indoors. And as it pertains to healthcare settings to protect Californians and healthcare workers, the California Department of Public Health recently issued 2 public health orders. The first requires workers in healthcare settings to be fully vaccinated to receive their second dose by September 30th, 2021. The second public health order directs hospitals, skilled nursing facilities, and intermediate care facilities to verify that visitors are fully vaccinated or have tested negative for COVID-19 in the prior 72 hours before indoor visits. Licensees to whom this pertains to are encouraged to thoroughly read the CDPH public health orders and regularly check their local health department's website for additional vaccination requirements. Questions from licensees about the healthcare worker requirements can be directed to the California Department of Public Health. And altogether, we know things are moving quickly and there's a lot of information, both official and unofficial. And so I encourage all members and the public to visit DCA's COVID-19 webpage for updates and resources on the state's reopening plan, public health guidance, vaccinator resources, vaccine distribution, and more. Next, I'd like to touch on DCA waivers. The full list of current waivers and guidance can be found on the DCA website. The department is still awaiting final approval on COVID-19 waiver transition plans for the waivers that have been issued and their status moving forward. DCA continues to encourage its boards and bureaus to look at laws and regulations that were waived, determine if changes are needed in the future, and move forward with those changes. Although some waivers may extend an additional short amount of time, they will begin ending at some point, and so accordingly, DCA encourages boards and bureaus to move forward with those statutory and regulatory changes as soon as possible to that end. And lastly, I'd like to provide a reminder about required board member trainings and the learning management system. As a reminder, 2021 is a mandatory sexual harassment prevention training year. This means that all employees and board members are required to complete the training during this year. Please also be advised that you will now access this training through the Learning Management System, or LMS for short, which is DCA's training portal. We have created profiles for each of you in the LMS and informed your executive officer of the steps you will need to take to log in and access the training. Board and Bureau Relations is also happy to assist you with any questions or concerns you may have about using LMS. And ultimately, the LMS will be used to house your training records and may also be used to sign up for other mandatory trainings. And to that end, I am happy to report that you can now register for the board member orientation training through LMS. As a reminder, newly appointed and reappointed board members are required to attend the board member orientation training within a year of appointment or reappointment. And the final training of 2021 will be held via WebEx on October 13th. And finally, as always, Board and Bureau Relations is here to help your board. So if there's anything we can do to assist you, please reach out. And that concludes my presentation, and I will hand it back over to Board President Fu. Thank you very much.
Thanks so much, Miller, for your presentation. Board members, are there any questions for Ms. Miller? All right, I'm not seeing any unmuted mics or hands raised for Ms. Miller, but I do have questions. So the first is related to the waivers, Ms. Miller. You had indicated that there's going to be a winding down of some sort as we continue to monitor the situation. I'm curious, what would trigger a reevaluation of whether or not these waivers continue to be extended, similar to the in-person meeting deadline of September 30th?
I think those are ongoing discussions being held, and as you mentioned this morning, with the Delta variant and how the climate is very fluid right now, it's something that per what's happening in the regular daily environment and how it's impacting the department activities and licensees, that those discussions are being had, and certainly as news is available, that's something that Board and Bureau Relations will be happy to work with other departmental personnel to make sure that all of our programs are aware of any changes, whether that be extensions or, as you mentioned, a winding down.
That's really helpful, thank you. And then the second piece is just if there is, in the event of an extension, because of the fluid situation we're in, would it be possible that we have a longer runway and notification period for this extension? I think I recall that with this last round of waivers, they were extended on the day of the expiration or the day before. And that causes a lot of concern and anxiety because we have licensees who want to be in compliance and want to make sure that they're adhering to the rules set forth by the state. What are the pain points for why the waivers are extended within 24 hours of expiration deadline? And what are opportunities for us to create a longer runway so that we can ensure that our licensees are able to comply to the ever-changing circumstances?
So what as with other policy changes that you're aware of, regulatory, what may be, there's several layers of review. And so I think what I'm more than happy to do and what I know the department is aware of is these concerns, and I'm more than happy to share that you have the requests for as much lead time as possible. And certainly, as I said, there's a lot of layers, so sometimes there's things outside of our control, but I'm more than happy to communicate that, and I know the department is trying to do everything they can as well to provide these updates and provide this information as best possible for all of our boards and bureaus.
Thank you so much, Ms. Miller. We really appreciate it. We're going to keep you on just for a little bit longer as we have public comments. So I appreciate your time this morning, and thank you for indulging our questions.
Sure.
Madam Moderator, could you go ahead and please open for public comment?
Yes, this is the moderator. Members of the public, the Q&A is now open. If you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen. Type comment or I would like to make a comment and send it to all panelists. No requests have been submitted. Would you like me to close the Q&A feature?
Please do. Thank you.
Yeah.
All right. I'm not seeing any further board discussion or comment for item number 6. So, Ms. Miller, thank you so much for providing these updates this morning and for spending time with us. We greatly appreciate it, and wish you a wonderful weekend.
Thank you. You as well. Thank you.
All right. Item number 7, the budget report. I'm going to turn this over to Mr. Glassbeagle.
Good morning, board members. Included in your hand-carry meeting materials is the board's budget report. Included in this report is spending through fiscal month 12, and I believe it's an estimated fiscal month 12 because the department hasn't finished closing out all the books yet, as well as a fund condition to show how many years we currently have with anticipated budgets before our fund reserves are depleted. And in addition, I've included in the memo a 1 through 7 plan of how to correct or continue to correct the structural imbalance that we are experiencing and pending insolvency. So we've already gone through the regulatory change, or we're in the process of the regulatory change to raise our fees to the statutory maximums. And then we would start at 1 included in the memo, and I'm happy to answer any questions.
Thank you, Mr. Glassbeagle. I think I have a question from Ms. Cervantes. Dr. Cervantes, apologies. Dr. Cervantes.
Thank you. I'm trying to figure out how to do this raising the hand thing, but you saw it, so thank you. Mr. Glassbeagle, I have a question, just thinking about our long-term fiscal health. And in our budget, we have these items, big ticket items, department pro rata, departmental services. It's not glaring at me, but even our fees, our legal fees to the AG's office. How do we anticipate those costs going up in terms of how we're planning our for our future, and in the event that we you know, how we restructure and all of those things, how are we taking account that those costs will probably increase, continue to increase year by year?
Thank you for the question. I've asked the moderator to promote Renee Milano from the Department of Consumer Affairs Budget Office. She is one of the budget managers, and I know that these numbers are set during the budget year or during the planning for the next budget year. But I believe she could probably add in a little more information regarding the how far they look out and how they plan for increases.
This is Renee from the budget office. Yeah, we actually build in, if you look at the fund condition located on, I think it's page 4, the projections based off of budget year plus 1 and budget year plus 2, we include a 3%, basically a cost of living increase, and that is accounted for in our overall expenditure projections there. In regards to how we project out the actual O&E or our operating expenses and equipment, similar to those items you mentioned, the pro rata, department services, attorney general, those are based off of basically ongoing spending projections. So based off of the most updated fiscal month report, we'll go ahead and project out based off of what we are likely to be spending for that year. Those are the two different methods that we primarily use to project out and account for increases.
So how far ahead are those projections? I mean, from here, it looks like it's 2 fiscal years.
If you're looking at the page 2, basically the expenditure projections report, those are for 1 year.
And so is that the best projection that we have by 1 year?
This is for the 2020-21 fiscal year projections, and it's based off of our fiscal month 12 report, which are pretty close to our final numbers for the year.
So, okay, so what I'm trying to understand is how we can better anticipate those cost increases as we think about the whole of the structure of our finances. If we end up asking our licensees for increased fees at some point, how will we justify that in terms of anticipating what our costs are to operate? And so I just zeroed in. I know there's a lot of different variables that go into our budget, but these are the ones I zeroed in on are significant to our operations, and so that is what I'm trying to anticipate. Can you speak to that about long-term projections rather than the month 12 and year by year?
And that is really more the fund condition, which is on page 4, and that is more projecting out to outgoing fiscal years. And we do build in a bit of a 3% cushion for basically cost of living increases and the like, as those items are more likely to become more expensive. And we do build in that into our projections in out years.
So it's really only about 3 years out that you're able to do that.
Actually, that's going to be your public document. In some cases, we do project further out, especially if it looks to have a structural imbalance.
Okay. Thank you.
Thank you, Dr. Cervantes. Dr. Phillips.
Just so it's clear for people listening to the meeting today, if I understand correctly, and either the representative of the budget office or Mr. Glass-Steagall can respond to this, we're anticipating, based on current projections, that we'll be fiscally insolvent in the next 3 or 4 years. Is that correct?
I don't know if Jason wants
Dr. Phillips, that is correct. By 2024, 2025 is our anticipated insolvency day at this time.
And what we are anticipating is that in all likelihood, we're going to have to increase fees for licensees, correct?
Correct. There is a 2-part increase. The first is to raise our fees to the statutory maximums currently that we have authority to do through the regulatory process. And then the second raise or a change, I should say, would come after a fee study is done, and then that is presented to the board to decide on the new fees, and then we'd have to seek an author in the legislature to modify our statute.
Much appreciated. Thank you.
Thank you.
Thank you, Dr. Phillips. And I think Dr. Harpsheets.
Yes, my question was, when I looked at the insolvency date, and then I looked back at on the first page of this report, numbers 1 through 7, are those proposed plans, number 1 through 7, included, if they were to come through, in that insolvency, in those insolvency numbers? I guess, in other words, would things look different in the 23, 24 column if all number 1 through 7 were to, the action items were to be implemented?
Good morning, Dr. Harjeet. Yes, that 1 through 7 is to rectify that structural imbalance, which puts us into the negative, further into the negative once we hit the negative, and to rectify our fiscal insolvency, which is that us drawing closer to 0 months of reserve. So yes, it would absolutely.
It would. So do you have any numbers that that might be kind of give us an idea of, for example, if these certain licensing fees were raised to X, and these changes were made based on what you have listed in 1 through 7, how we might look, just as some idea?
I don't have any idea at this time. My understanding, although I've never been through a fee study before, but my understanding is during the fee study process, I am aware that they will visit the board and sit with staff and review how long it takes to do specific parts of a task, and specific tasks within the licensing process and renewals and application process. But then I believe they will also look at all of those other factors as well, to see just kind of and they make a recommendation of what the fee needs to be to rectify the structural imbalance. And I assume it's also to include the appropriate months in reserve in our fund that kind of stays and doesn't get pulled out. If I believe Matt Nishimini might be on the line as an attendee, if he might want to add something further, because I believe, and Ms. Milano, correct me if I'm wrong, but if you can speak to it, absolutely. If not, maybe we can promote Mr. Nishimini, Matt Nishimini from the budget office, if he's on the line.
That is what the fee study does provide. So that is accurate. They will give us the information on what their recommended fee would be in order to solve our insolvency rate. And then we actually they will work with the board and bureaus basically towards that discussion, and will provide a report that can then be used to help with any solvency issues. That's really the intention of the fee study.
Thanks to both of you.
Thank you, Dr. Harpsheets. All right, I'm not seeing any further board comment at this time. So I'm going to go ahead and turn to public comment for discussion of this item. Madam Moderator?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. Members of the public, if you would like to participate, please click on the Q&A icon located at the bottom right corner of your WebEx screen and type comment or I would like to make a comment. And actually, I apologize for interrupting myself here. I do see someone has their hand up, and I believe that be Matt from the budget office. So I'm going to promote. Would you like me to promote Matt at this time?
Yes, just in case he can respond to any questions as well.
I believe that is Matt, if he can please confirm.
Would the person with the title FIMNISH please unmute yourself and just confirm your...
Yes, good morning. This is Matt Nishimini with the budget office. Can you hear me?
Yes, we can. Good morning. Thank you, Mr. Nishimini.
Very good. So thank you for inviting me again today. I've presented in the past in front of this board. So I would concur with everything that Mr. Glass-Steagall and Ms. Milano said about and how they characterized the fee study and the projections in the out years. The key to a good fee study is interaction with the board staff and board members in the planning. With this board, the main driver of costs in recent years and the current main driver are enforcement-related costs. As you've increased your enforcement-related activities, it's also had a commensurate increase in your D of I costs and in your AG and your OAH costs to adjudicate those cases. So to the extent you're moving out in out years, and we see that those are still going to increase, we need to factor that into the fee study. Otherwise, the fee study is going to really look at what the baseline budget is in the out years, and it's going to work to eliminate or to right size the revenues consistent with the budgeted amounts in the out years. Does that help?
Thank you, Mr. Nishimini. I think that does that help question maybe directed to our colleagues who ask questions. So, but certainly any folks who, if you have follow-up questions, Dr. Harbstreet, I see you're unmuted.
Yes, I just wanted to say thank you because that did help clarify for me. Thank you.
And I think Dr. Cervantes was concerned about the out years.
Yes. Thank you. I'm curious if there is any. What's lingering on my mind is when I joined the board a couple of years ago, there was a fee increase from the Attorney General's office, and it was my first year on the board, and it seemed that it was not expected. And so I'm wondering, is there a statutory requirement on behalf of state entities to create those, like in this case where we're paying, there's state entities that are part of our budget. If there's some kind of requirement that they kind of let us know ahead of time, so that those surprises and so that staff can plan accordingly. That's my question.
Right. So specifically with the AG increases, we did not have much time or very little time notification to plan ahead. And so there is no statutory requirement. The AG, fortunately, is our partner in this, and they are another agency that we cannot control their hourly wages or the invoices that they charge.
And what about other state entities, including DCA, to help plan, or does that become part of that fee study in terms of planning ahead for when there may be increased costs on behalf of the other government entities that we interact with?
So it would be part of any fee study, future fee study. I don't think that there are, besides the AG and OAH, I don't think that the board has much expenses going out to other state agencies. So unless I'm wrong, I would have to defer to Mr. Glass-Steagall and to Ms. Milano on that.
I think you're right, Mr. Nishimini. It's AG and Office of Administrative Hearings, I think, are our biggest expenses outside of DCA.
And I would just note that while AG and enforcement-related costs have gone up, and unfortunately, no one likes to pay more for the price of milk, right? none of us here do. But unfortunately, it's sort of the cost of doing business in this day and age. And the fact is that you're doing your operational duties. You're doing your baseline functions to maintain strong enforcement, robust enforcement activities. And that really is one of your main charges, right? You're supposed to license and enforce your licensees, regulate your licensees. So to the extent you're doing that and those cost pressures are increasing, well, you're really doing your job. And so we really look at enforcement related activities as one of the most justifiable reasons for cost increases. I mean, you could as a board, you could opt to not send cases to the AG, but then you would not be doing your responsibility as a regulatory body. But it is your option to do that. If you wanted to drive down costs. But you guys are opting to do your enforcement related responsibilities. And as a result, your enforcement related costs are going up or have gone up in the past.
Dr. Cervantes, does that answer your question?
Yes, thank you. My main concern is just how we can anticipate those items, because they're central to what we do as a government entity. And so to the extent we could anticipate those costs and helps everybody plan better. So thank you.
Thank you, Dr. Cervantes. Ms. Nystrom, and then actually, Ms. Nystrom, before I go to you, I think Ms. Sorek may have a response to this conversation. So Ms. Sorek, if the comment you're making is relevant to the thread here, I'm going to turn it over to you. And if it's not, we can turn to Ms. Nystrom. I know she's been waiting for a comment as well.
I'll try to be quick just to add a little bit of context. During my tenure with the board, and I started in 2013, this is the second Attorney General increase to my memory. So it is not something that happens very often, more often than our fee increases, because it was the 90s that we last looked at our statutory fees as far as renewal fees are concerned. So I just wanted to add that context to the frequency of increases. And as Mr. Nishimini mentioned, there are several components that go into attorney costs, hourly costs, as well as our investigator fees. And many of those have to do with salary adjustments over time, which happen kind of incrementally and through the collective bargaining process. And our budgets respond to those kind of statewide implications, and then it trickles down from there. And I just wanted to add that context to the discussion, and that's all. Thank you.
Thank you, Ms. Sorek. Ms. Nystrom?
Hi, this is Ms. Nystrom. Thank you for all of the information. I just wanted to follow up on Dr. Cervantes' questions a little bit. And with the Attorney General's office, I just wonder, I know in state government we have lots of conversations about the left hand working with the right hand, and I just wonder if there's an opportunity for us moving forward to have regular conversations on if they are considering increases. I mean, I think even the conversation we had, a heads up if they were considering increases, sometime prior to that announcement being made, that might be helpful to folks just to, have those conversations. And so I appreciate that. And then on the fee study, I look forward to when that comes before us to see kind of what the parameters are a little bit closer as to what the the folks are looking at exactly, because I'm also interested in efficiencies, which I know our executive director, Ms. Sork, has, constantly, and the team constantly looking at, but I think that's something that's always good to look at as well when we're talking about the increase.
Thank you, Ms. Nystrom. I know Dr. Jolinda Crow has been waiting for public comment, and I see that she's indicated she would like to make a comment. So I'm going to flip this over back to you, Madam Moderator, and to ask that Dr. Jolinda Crow for her public comment.
This is the moderator. I have sent a request to unmute your microphone. And that's for Jolinda Crow.
Yes, can you hear me? Hello?
Yes, we can.
Okay, this is a new format for WebEx, and so some of us are trying to figure out how to navigate the new format. I had a quick question. I had two questions. It's a little hard to follow the whole thread of the conversation with all of the intricacies of state budgeting for those of us who aren't involved in that on a regular basis. I want to be sure that I'm understanding something. It sounds as if the Attorney General's office has said that they are going to charge you more for services. And first of all, I'd just like to know, is that accurate? Is that what this is about?
Dr. Jolinda Crow, I think you said you had two questions, so let's take both questions and then we'll turn it back around and ask.
Sure. Well, if
that's
sure, if that's true, then it sounds. Is it an automatic assumption that any increase in those sorts of fees that the board has to pay to other state agencies, if I'm understanding this right, that's automatically a pass through to licensees? Or in lieu of, I don't know, like reducing expenses in other areas, that sort of thing. And I, again, just have to come at this from the context of, I'm the CEO of the California Psychological Association and manage our budget. And it's just so, I think we operate a little bit differently. So I'm just trying to understand, is it just an automatic pass through to licensees if you have any increases in the fees that you have to pay?
Understood. Thank you, Dr. Jolinda Crow. So I'm going to turn those questions over to you, Mr. Glass-Beagle, that Dr. Jolinda Crow presented on, with regard to the Attorney General's increases, and the second, the question about pass-through, if it's automatic, quote unquote, automatically pass-through.
Thank you. Good morning, Dr. Jolinda Crow. No, there is no discussion right now with the AG's office, and we have not been alerted by the AG's office, and I don't think DCA has either. And Ms. Milano can add to that if she wants.
That is correct.
Great. No, you're fine. There is no anticipated fee increase from the AG's office. I believe the discussion was just around the limited amount of time that we were alerted to the fee increase, and additional questions about if there's another one pending, and if so, and if not, when they do need another one, if they need another one, if there could be more discussion ahead of time. Regarding your second question about if it's a pass-through, I mean, the board is supposed to have all of its fees covered. We are a special fund program, so we don't get any general fund money. So any money that we do spend is money of the licensees. So all of our costs and fees are built and then derived out to apply to different parts of the licensure application enforcement process. But we are always go ahead.
If I may.
Yes.
So on this particular piece here with regard to pass-through, yes, absolutely. Cost containment is a part of the strategy with regard to the budget. And in fact, for the last several years, the board has engaged in cost containment strategies, as well as the use of our reserves. I think what I'm hearing here, Mr. Glass-Steagall, and reading the report is that for the last 3 decades, the board has not raised licensee fees. And that due to, and meanwhile, over 30 years, the cost of operating, and one can attribute to inflation over 30 years. Certainly the value of today's money is not the same as 30 years ago. That with 3 decades of inflation, of growth overall, that the licensing fee presently, if I'm understanding correctly, doesn't reflect the cost of operations anymore. That what was set 30 years ago, is no longer reflective of the actual expenses of the board. Is that accurate, Mr. Glass-Steagall?
That is accurate.
Thank you. So I think with regard to this idea of pass-through, certainly we've over the last 3 decades, the board has taken on additional expenses to meet the needs of licensees and consumer protection as the primary objective. And I think what I'm reading and hearing here is that the board has engaged in various strategies to keep licensing fees as is for 3 decades. And that we've now reached a point where we're projecting in out years that what we asked 30 years ago is no longer sufficient to cover the board expenses due to the changes in inflation and operating expenses overall. So, Mr. Glass-Steagall, I will pause there and just confirm with you that is what is presented in the staff report.
Yes, it is. Well said.
Thank you.
Thank you very much. Just one quick follow-up, and then I'll be done. This is very helpful. During my tenure at CPA, which is now about 17 years, there were many years that the board operated with a surplus, to the point for several years that the general fund took that surplus back. And what I'm hearing you say, I think, is that that is no longer the case, and that your expenses have risen, and therefore the fees don't keep up with the expenses. Is that right, Mr. Glass-Steagall?
You are correct. We are operating with what is known as a structural imbalance.
Okay, thank you very much. Appreciate it.
May I clarify just one point? This is Matt again from the budget office. So
Yes,
any general fund loans, any funds from the psychological fund that was provided as a general fund loan, those were all repaid back with interest. So it wasn't as though they were swept.
Thank you, Mr. Nishmini. And that's in reference to I think the comment that was made with regard to the loans made during the years when I think the state was experiencing severe deficits during the economic recession. So I think that was probably 2008, 2009 fiscal years, if I recall that budget deal and late budget. And then probably there was a general fund loan also made in previous years too. I think when we thought there would be a larger budget deficit last year, that obviously turned into a budget surplus. Is that accurate?
That is correct. That is correct. Sorry,
Yes,
Renee from budgets.
No worries. Alrighty. So I don't see, I see that we followed up with Dr. Jolinda Crow. So thank you, DCA, for marking that. And then I don't see any further board discussion or questions on this item. Certainly, if there are questions and that come up afterwards, I know that Mr. Glass-Steagall and Mrs. Sorg would be very pleased to answer them. So please do follow up with them if there are additional questions on that front. So we will go, I'm mindful that it's been an hour and that we may want to take a brief 5-minute recess to provide any caregiver duties, etc. And so I'm going to ask that we go ahead and go into recess and come back at 10:10. So we're going to round up and give folks an extra couple minutes. So we will return at 10:10 to our board items? Thank you.
Thank you. This is the moderator. We will have the time displayed in just a moment, and I have closed the Q&A feature. Thank you.
All right, the time being 10:10, we will bring the board back from recess. Because we can't visually see each other, what we will do is go ahead and ask Ms. Berteau to call the roll so that we can demonstrate that we have quorum. So Ms. Berteau, could you please call the roll?
Sure. Cervantes?
Aye. Here.
Fu?
Aye.
Thank you. Fu. Thank you. Hardsheets?
Here.
Nystrom?
Here.
Phillips?
Here.
Riscate?
Here.
Rogers?
Here.
Tate?
Here.
Thank you.
All right, the board, we have a quorum. So we will now turn to item number, I believe it's item number 8, because we are done with the budget report. Oh, yes. All right. So we have item number 8 here with regard to the Health Professions Education Foundation on licensed mental health services, provider education program, and then our mental health loan assumption program as well. And so with that, it's my pleasure to welcome our colleague, Michael Andrich. Michael Andrich has over 10 years experience managing projects and programs in both city and state government. And after completing his master's in public administration at the University of San Francisco, Michael joined the Office of Statewide Health Planning and Development as a program manager with their Healthcare Workforce Development Division. For the past 3 years, Michael has overseen 12 scholarship and loan repayment programs that offers financial assistance to healthcare professionals and students. And through the great work of the department and the division, Michael hopes to continue making an impact in California's underserved communities. So Mr. Andrich, I will turn it over to you for our presentation today on these programs.
Mr. Fu, we are just working on muting him.
Everybody here?
Yes, Mr. Andrich, we can hear you.
Thank you. Thank you, board president and board members, for having me today to present. I just do want to give a little feedback on the mental health loan assumption program. We actually do not administer that program no longer. That sunset back in 2018. So that program no longer exists. But we still do provide the licensed mental health services provider education program.
Thank you, Mr. Andrich. Important update as it relates to this presentation today. Please do continue. Thank you for that. And we'll ask our board staff to update that for the future. Thank you.
And do I have the presentation right? Okay. So today I'll go over the program itself for the licensed mental health services provider education program, what the qualifying facilities are, eligible professions, what the Board of Psychology fund balance looks like, and overall budget overview of the entire program for LMH, as well as give you a little background of our last cycle award summary, some of the challenges that we've encountered during our last cycle, how to apply, and then how anybody can contact us. So the licensed mental health services provider education, you'll probably just hear it called LMH, was statutorily created, and it's administered through the Health Professions Education Foundation. And how it works is applicants will apply, and if awarded, they can earn up to $15,000 in a max award for serving a 2-year service obligation in a medically underserved area. They can apply and be awarded up to 2 times. And eligible disciplines for this program include psychologists, your therapists, and counselors. So there is a wide spectrum of eligible disciplines that can qualify for this program. So the qualifying facilities for this program, so if somebody applies, they have to be working in one of the following: either a health professional shortage area that has a mental health designation, a nonprofit private mental health facility, a publicly funded or public mental health facility, a publicly funded facility, and others that we do recognize as underserved are correctional, county, or veteran facilities. So as long as applicants are working in that, they would qualify for that designation. So all our fees for the Board of Psychology get deposited into the Mental Health Practitioner Education Fund. And as of May 2021, we had $237,960 in licensure fees. So that was deposited by the Board of Psychology, and we also do receive fees from the Board of Behavioral Services. But this figure of $237,000 is just specifically the fees that were collected by Board of Psychology. Now, all the funds collected within that fund don't go completely to awards, although 90% do. Some of those funds are dedicated for administrative costs and for processing of awards. So just a quick little Lmh budget overview. So as you can see, available funding for 2019 through 20, the Mental Health Practitioner Education Fund, so this was just for licensure fees, we had $525,000. And for the next 2 fiscal years, that went up to $693,000. Now that available pot is to be split between Board of Psychology and Board of Behavioral Services. Then we also had funding from our general fund from the mental health workforce, and then a separate pot from the general fund for foster youth that were working in the mental health field. We also do receive special grants such as from Kaiser and health plan mergers such as CVS. And so we try to use those funds that are available to also funnel into the Lmh program. So last cycle, we received 642 applications and we made 543 awards. Not all applications that we receive are awarded. They have to meet the minimum scoring criteria. And then, as you can see, some might decline their award. By the time they apply to the time they're awarded, their situation may have changed. They may no longer qualify or may not want to accept the award. So that's why there might be a difference in the number of awards. And with all the funding, not just from licensure fees, but from our special funding and private grants, we have over $11 million to award, and we made close to $8 million in awards. So this is specifically just for the Board of Psychology award summary, what we use just for licensure fees. So you can see in 2021, we had 30 that were received, and we were able to make 10 awards based off licensure fees alone. In 1920, we had 77, and we can make 6 awards off of that. And then within 2018-19, we had 44 and made 6 awards. So we're really pretty close in maximizing the licensure fees we have and making those awards. Some of the challenges that we did hit in our previous cycle and still are kind of going through was, of course, the pandemic of COVID-19. So we had a lot of awardees that were starting to relocate out of state because either their spouse or they were moving to find other employment. They accepted another position within a non-qualifying facility, and that was just, it could have been better pay, better situation or designation closer to where they live. They were on a leave of absence and they were no longer going to return back to work, or they were no longer meeting the 32 hours of direct client care requirement for our program. And those challenges impacted 22 awardees. So they had to end their contracts because they weren't able to fulfill the requirements of the program. And one thing to note is when we hit these challenges, we will do our best to work with all our grantees, whether it's through contract amendments, extending the contract term. However, we can best support them because we don't ever want to end a contract. We want to try and provide them the best solution to continue as possible. So how to apply? We do have an online application portal. and we've recently migrated to Microsoft 365. So the site that previous applicants applied through, it looks the same, but it functions a lot better. And so anytime if there's applicants that are interested in the program, they don't have to wait until the cycle is actually open. They can go in and create an account. So when that cycle comes around and it's open, they're ready to go just to apply. And for our next cycle, we are actually opening at 3:00 p.m. on September 1st. And that really concludes the presentation. Everybody can reach us at our general HPEF email, as well as if you visit our website on the department, you will find contacts for each program. So that way you're not just clicking in trying to hope for somebody to respond. You can go specifically to LMH and that'll take you directly to those that oversee the program.
Thank you so much, Mr. Anrich, for your presentation. Are there questions from the board or board members? Dr. Cervantes, your hand's up. Over to you, and then I'll go to Ms. Nystrom after that.
Okay. Hi there. Good morning. I have two questions. One is you referenced criteria for qualifying for the grant. If you could speak a little bit to that. And then second, there's an amount in one of the slides that says the fund balance for psychology is $237,000. And I wondered if that was for the last, it doesn't have a time frame, so is that for the last year? Is that about the amount that's available every year? If you could just kind of give us a sense of that.
Usually it is on a fiscal year. The hard thing with how they're collected is our accounting periodically on months, and then they have to update it on our spreadsheet. So at that time it was at 237,000, but typically by the end of the fiscal year we have close to 400 to 500,000. And then for the criteria part, we do ask that they're willing to work, serve a service obligation for 2 years. They have to have educational debt that's in their name. They have to work in a qualifying facility, be in a qualifying profession. And then how we score is we're really looking for who's best suited culturally and linguistically. So during the application process, they will have personal statements that they're going to be able to describe how they can relate to these underserved communities that they wish to work in. And so that goes through a scoring committee, and they review those and score, and based off their whole application, they're generated a final score, and that's how we make those awards.
So it's so if there isn't enough people who meet the score, whatever that cutoff is, then that funding gets held over. So for example, when you said that there were people who couldn't fulfill the obligation, so their contract ended, there isn't other folks in the pool that can come in and meet that, so that there isn't gaps in terms of there's the funding is being awarded and there's a workforce in these spaces that need it.
Correct. So unfortunately, once somebody ends their contract mid-service obligation, those funds will be disencumbered and used for the next cycle. We're not able to generate a new contract midway. That's just due to our procurement processes. But we do roll those funds over. The nice thing is we have been able, the past 2 cycles, because of the extra funding we've had, we've been able to award everybody that has applied and that was eligible.
Thank you.
Ms. Nystrom.
Oh, hi. Yes, thank you, Mr. Anderson, for your for your presentation on this. Just a couple of follow-up questions. So the Board of Psychology has put in $237,000 plus a little bit more, the $1,000 into the fund, and it's awarded $150,000. Is that accurate?
Correct.
Okay, and so then we have a surplus. Does the funds that the Board of Psychology put in go to Board of Psychology licensees or to the fund in general? So either we could pull from it or another board could, or another licensee could pull from that fund? Is that accurate?
It actually just in the mental health practitioner education fund, but it's earmarked LMH, so nobody would be able to touch those funds, and they would just be used for the next cycle.
Okay, I appreciate that. And then with respect to the administrative costs, you indicated that some of the funds go. Is there a specific amount, like 10% or something similar?
It is 10%, and that's split between the staff that are actually administering the program, and then another 5% goes to our accounting that has to process the invoices and the contracts.
Okay, that's all I have. Thank you very much. That's helpful.
Thank you, Ms. Nystrom. And I think Ms. Nystrom raised the question that was clarified and answered here, that the fund supports our Board of Psychology licensees and registrants. So this is specifically for Board of Psychology licensees and registrants, not for any other board or bureau in the behavioral health or mental health fields. So with that, I'm going to go to a public comment on this item.
The moderator, I've opened up the Q&A. Members of the public, the instructions are on the screen. Simply click on the Q&A icon located at the bottom right corner of your WebEx screen. Type comment, or I would like to make a comment, and click send to all panelists. Board President, no requests have been submitted. Would you like me to close the Q&A feature?
Yes, please. Thank you so much. And we will turn to Dr. Rogers for comments or questions.
Thank you so much. And thank you for the presentation. That was really helpful. I have two questions. The first one is regarding the award structure. I see that it says the award amount is up to $15,000. I was just curious about how someone qualifies for the full amount and what would make someone get less than the full amount. Is that based on the criteria that you were talking about before and the score that they get?
That's a perfect question. So when it comes to the award amount, we will always try to award the max. Mm-hmm. And how somebody gets less is when we go to award, it's based on the educational debt. So we will never award somebody more than what their educational debt is. So some may have less educational debt than that $15,000 that's pretty rare, but that's the reason that they would receive less funds than the max.
Okay, that's helpful. Thank you for that. And then the second question I have is, how do you advertise about this program so that licensees can find out about it, know that it exists, and apply?
So right now we do a stakeholder announcement that goes to all of the departments, as well as some other stakeholders for the mental health workforce. And on our website, we do advertise it, as well as with the state library. The California grants portal that they've created, we also advertise through there. So anybody in the state of California can go on that portal with the library and find opportunities.
Well, this is absolutely fantastic. So thank you so much for sharing today.
Thank you.
Thank you, Dr. Rogers. And Mr. Andrich, certainly if there are opportunities for the Board of Psychology, if there are social media collateral or language that the board can potentially use to help advertise and share this program, I know we certainly would appreciate it. And I know that it's something that I know the outreach committee potentially might be also keen on looking into as well. I did notice that in 1 year we had over 77 applications, or we had 77 applications. And then presumably the drop in applications was due to the pandemic and things not being able to be as accessible perhaps in classroom environments where you might see this on a bulletin board or connect with someone else on it. But, I do have a question real quickly on the general fund piece related to foster youth. Specifically, you had highlighted that there were dollars there set aside for foster youth. This is for folks who've completed their education or who are applying for and receiving their doctoral degrees, or is it separate and apart from the criteria that you've outlined for us here today?
So it will meet the same criteria as outlined here before, but there was $1 million set aside for health professionals working in the field currently that were also part of the foster youth system growing up. So if they do apply, they would have to submit that verification that they were former foster youth, and then we can allow those funds to be used.
Thank you for that clarification. All right, I'm not seeing any further board discussion on this. And so we will go ahead and move to item 9. Our thanks to you, Mr. Andridge, for the presentation today. That was very helpful.
Thank you for having me.
All right, item number 9, Ms. Monterrubio. Let's see. I think I see Ms. Monterrubio on our participant list, but I don't see her muted. Excuse me, unmuted. And I know our partners.
Can you hear me now?
Yes, we can. Thank you.
I am sorry. I was talking this entire time. I apologize.
The great American novel was spoken over the last couple minutes. Ms. Monterrubio, for the enforcement report, over to you, please.
Thank you very much. So attached to my report, you will find the overview of enforcement activity, conveying the complaint, investigation, and discipline statistics for the current fiscal year, as well as the performance measures. Before I present the information in the report, I'd like to apologize for a mistake I made. And the year noted in the report is 2022, and it should be 2021. So again, I do apologize. I do have some exciting news to report. We have finally filled our office technician position. Our new employee will begin on September 1st of this year. And as many of you know, the enforcement team has absorbed the workload of the OT desk for quite some time, all while managing their own workload. I'd like to personally thank the enforcement team for all of their hard work and positive attitudes. I truly have an amazing team, and I appreciate all that they do. In regards to our complaints, we have received 106 complaints since July 1st of 2021. All complaints received are opened and assigned to an enforcement analyst. At our last board meeting, Ms. Nystrom asked if there were any possible trends related to enforcement and the pandemic. A search of our complaint records didn't reveal any major trends. However, we have received complaints regarding licensees who let their license lapse and said it was because of the pandemic and stress. A few other types of complaints we have seen are licensees not complying with local health orders regarding masks and social distancing. Since July 1st of 2021, we have issued 4 enforcement citations. And again, citations are issued for minor violations. We have referred 5 cases to the Office of the Attorney General since July 1st, and we are currently monitoring 45 probationers. And of those 45 probationers, 1 is out of compliance. Again, being out of compliance can result in a citation and fine or further disciplinary action through the Office of the Attorney General. If we were to take a look at the overview of enforcement activity, at our next enforcement committee meeting, we will be discussing with the committee members on how we are going to report this information for November. We are looking to see what changes need to be made so that the board has a better understanding of the statistics and it's more useful information. So we will be drafting a new way on how we're going to report that information, having our 2 committee members review that and provide us feedback. So you will see the statistics reported differently in November. And I am available to answer any questions.
Thank you so much, Ms. Monterrubio. I see Dr. Harpsheets is unmuted, so I'll go to Dr. Harpsheets, and then I see a raised hand from Ms. Nystrom, so we'll go to Ms. Nystrom after Dr. Harpsheets. So Dr. Harpsheets, over to you.
Thank you very much. I wanted to know a little bit more of these 106 complaints. Ms. Monterrubio, you were saying some of them involved complaints about psychologists not either following mask mandates or physical distancing. So would that, just so I understand, would that be potentially a complaint could be made to the board about a psychologist, say, in their office seeing someone face to face who was not requiring or wearing a mask? Or could you tell me a little bit more so I could understand that?
Sure. We have received some complaints where clients have informed the board that their psychologist was not practicing good safety measures, that they maybe took their mask off and maybe were eating their lunch during the session or were not socially distancing. We investigate those type of complaints. We will reach out to the respondent for a response. I will say those type of complaints are very difficult to substantiate because they are a maybe he said, she said type of complaint. And there's usually not any witnesses. So we definitely investigate those complaints, but they are hard to determine whether or not that truly happened. I would say though, we have probably received a handful of those type of complaints since the pandemic started.
It's still important to recognize because, you know, the guidelines have shifted at different times, but as far as I know, there was not a hard and fast rule. And so I wonder if then your staff has to look, well, what are the actual guidelines? And then, you know, in terms of informed consent, I think would become relevant. Did the psychologist provide informed consent about mask wearing or not, or those kinds of things? But yeah, go ahead. Sorry.
Absolutely, Dr. Harpsheets. When we reach out to the respondent, we are obviously first looking at the local health order. And then we'll reach out to him or her and we'll ask for an explanation or basically their side of the story. And then once we have all the information, depending on all of the allegations that are listed in that complaint, it might be something that one of our analysts can just take a quick look at and determine whether or not there was a violation. We also consult with our experts as well. But we do look at every complaint and we will address the consumer's concerns. But again, the first thing we're going to look at is the local health orders.
Got it. Okay, thank you so much for that clarification.
You're welcome.
All right, thank you, Dr. Harpsheets. I'm going to go now to Ms. Nystrom, and I know Dr. Cervantes is also in the queue.
Hi, Ms. Monterrubio. I just wanted to say thank you for and to your team for taking a look at some potential trends. I think it just gives us a good snapshot, and I just want to say thank you.
You're welcome.
Dr. Cervantes?
Hi, everyone. I just wanted to thank the whole of the enforcement team. The volume of work produced is impressive. And we see it on a regular basis when we're asked to review cases outside of our public meetings like today. And so I just wanted to acknowledge that. And I also wanted to hone in on the part of the report where Ms. Monterrubio indicated that we would see these reports in possibly a different format. And I just appreciate that. I think it would be very helpful to have more analysis so that we can have a better big picture understanding of the volume of work produced by the enforcement team. I just want to reemphasize, to me, it is absolutely impressive. And so I think, but I don't think when we get individual data points, it conveys the type of information, the type of analysis that's needed for the purposes of policy making. I think it's important to have all of these data points. They're very important to managing workflows and different things operationally, but I'm looking forward to what folks come up with in November. Thank you.
Thank you, Mrs. Cervantes. I really do appreciate your kind words about the enforcement team, and I know they do as well.
All right, so I'm going to go now to public comment on this. Oh, wait, actually, I see Dr. Harpsheets, you raised your hand again. So let's go to you first before we go to public comment.
Thank you. Okay, earlier in our meeting today, there was something maybe in the budget report, but I can't remember. Someone talked about the enforcement section either increasing their efforts or sort of doing more. And I wondered, Ms. Monterrubio, if you could clarify what was meant by that. Maybe how are you doing things differently, you know, and really what was meant by that comment? What's different?
I'm not sure if I heard that comment. I did listen to the budget report. What I can say about the enforcement team is we have not done anything differently since the pandemic hit. We are processing cases the exact same way we were before. Nothing for us changed. We utilize our experts to help review cases. Any case that needs to be referred to the Attorney General's office, we will forward that. We have not withheld any cases where there is evidence of violations that warrant discipline. We have not held back on enforcement. We have done business as usual. Nothing has changed. We investigate every complaint that falls within our jurisdiction. We may or may not have an expert review depending on the allegations. If an expert does determine that there is enough evidence and can testify to that evidence, we will forward to the Attorney General's office. We have a great working relationship with the AG's office. If they have questions about a case, they will contact the analyst that is assigned. If we have a case that doesn't warrant discipline, we will issue a citation and fine. But for us, we have not done anything differently.
I think I'm sorry to interrupt you. I think the inference was that you were actually doing more and not less. And it was sort of a general comment, but it sounds like you're just doing what you done, but I just wanted to ask about it. But thank you for the clarification.
You're welcome.
All right, let's go ahead and turn to public comment. So we will, Madam Moderator, please open the public comment section.
The moderator, I've opened up the Q&A. Members of the public, the instructions are on the screen for your reference. If you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen and type, I would like to make a comment, or simply comment, and click send to all panelists. And I do have a request from Elizabeth Winkleman, and I believe that's Dr. Winkleman. Please correct me if I'm wrong. I'm going to request to unmute your microphone in just a moment. And the request has been sent.
Hello. I think my microphone's open now. Hi, it's Dr. Elizabeth Winkleman. I'm Director of Professional Affairs at the California Psychological Association. Ms. Monterrubio, I wanted to thank you for your enforcement report and ask a question in terms of the mask requirements. My understanding is that psychologist offices would be considered healthcare settings, and therefore that they would be included in statewide mandates that are currently in effect for masking, requiring masks.
You are correct, Dr. Winkleman. That is my understanding as well.
Thank you for confirming.
I don't see any additional public comment on this item, but I do have a related question to what Dr. Winkleman just asked, which is if a local health order, public health order is more stringent than the state health order, where would that fall in terms of which to follow?
You know, I think in that case, which I haven't come across yet, I think in that case, we would definitely have to consult with an expert in that local area. And if we felt that or if we had enough evidence to determine that there was a violation, it could result in a citation and fine, which again, licensee has a right to appeal, and it could go to the Office of the Attorney General, and a hearing would be scheduled. I have not come across that situation as of yet, but in that event, I would imagine we would definitely have to have an expert consulted on that matter and figure out where to go from there, because that would be very difficult.
Thank you so much. That clarification is helpful, and glad to know that hasn't happened yet.
No.
Thank you, Ms. Monterrubio. Just for Madam Moderator, I just want to highlight that we do have a attendee who raised her hand and may not have input the request for public comment. So may I ask that we go back to public comment, and if the person who raised their hand could just type into the chat box that they would like to make a comment to confirm that they would like to make a comment on this item. Our moderator at the start of our meeting presented the protocols for engaging this, but I know that folks may be joining on after the fact. So if you do have a public comment, to go ahead and please type in, I have a public comment for this item. The hand raising feature is not being used for public attendees.
Thank you, Board President. This is the moderator. The Q&A is open. And again, as Board President stated, you can type, I would like to make a comment, or comment in the ask field and send it to all panelists. I did receive a request from Melody. My apologies when I tried to. Okay, yes, I have a question from Terry Key. I'm going to request to unmute your microphone now. Go ahead.
Now?
Yes, I think we can hear you, Dr. Key, or is it?
Yes, yes. So back to the mask paranoia. I'm just checking if you're in session for an hour with your patient and you need to take a drink of water. I'm usually, 6 feet away from my patient. I'm hoping that wouldn't, and I had to unmask to take a drink of water. I'm like hoping that wouldn't be a terrible grievance.
Hi, this is Sandra. If
Yes.
we were to receive a complaint that a licensee took off their mask to take a sip of water and put the mask right back on, I don't see that being a problem. Would we still contact you to address the allegation? Maybe, or we would, maybe we would not. I mean, I think we all understand that we may need to have a sip of water from time to time. I think most people have taken off their mask, taken a quick sip of their drink, put the mask back on. If there were additional allegations that the mask was left off for a longer period of time, didn't put the mask back on right away, then we would most likely contact you and have you address the allegations. Again, I want to remind everyone, complaints are not public information because we know everyone has the right to file a complaint based on their own concern. That information is not shared. If we were to take disciplinary action, did I address your concerns, doctor?
Yes, thank you. I just
Okay.
wanted to make sure.
You're very welcome.
Thank you, Ms. Monterrubio and Dr. Key. I just want to acknowledge that Dr. Schaefer has indicated their difficulty with the technology in the chat box. And so I want to make sure that Dr. Schaefer doesn't have a public comment as it relates to this item here on the enforcement report. And then secondly, if there can be a way, a link to a page or something that I can share that's solid, you can provide me to guide people who may be having technology challenges. I'm happy to voice that and share that where that information is posted. So let's go ahead and ask if Dr. Schaefer has a question with regard to this item on this front.
The moderator, Dr. Schaefer, I'm going to send a request to unmute your microphone. You can let us know. And the instructions should have been attached to the meeting agenda. I will double check that and let you know.
All right, so Dr. Schaefer, my understanding is that you've been unmuted. So if you have a public comment for this item, please go ahead. And I know that our colleagues at Solid are double checking the agenda items with regard to the instructions for using WebEx. So Dr. Schaefer, you're trying to unmute your button, but it won't work. And that does sound like that's something on your end to not something that I can be doing remotely. But I wonder if Solid, you can do that on your end to see if you can unmute her.
Yes, I'm unmuted. The only thing I can do from my end is send her a request to unmute her button. And as it's shown on the screen right now, she'll receive a pop-up window from her end where it says unmute yourself. You are being asked to unmute yourself.
All right, so my understanding is that Solid has sent that request to you, Dr. Schaefer. And so it should be appearing on the device that you're using to unmute yourself. And certainly if you are in a place that has colleagues or folks who can assist you in using your device, that might be helpful too. But it looks like, Madam Moderator, you have made that request for unmuting, and that it's now dependent on the user to go ahead and unmute themselves.
See, yes, the button does not work. At this point, if she would like to submit the request, oh, I see that she has been unmuted.
Okay, I had to hit something on the screen rather than the unmute button at the bottom, which will not work, the one that says to hit. So my apologies. I tried 2 other times to speak, and the text box would not open no matter how many times I lit up the Q&A, so it wouldn't even reveal itself as a problem. And then the mute button that you're supposed to hit per the instructions, if I hit it, would not unmute. So this time it worked. If it happens again, I'll just come out of the meeting and power up everything again. But thank you, and sorry for taking your time. It's not that I don't see the instructions, it's just it would not respond.
No worries, Dr. Schaefer. Do you have a public comment on this item?
Nope, not anymore. But I may have comments later, so I'm glad it's working in the moment. Thank you for your patience.
No worries, Dr. Schaefer. Thank you. And Dr. Winkleman, I do want to acknowledge your comment that you've provided a couple of times in there. Certainly, we will continue to provide ample time for people to provide the public comment. And as you can tell, when Dr. Key raised their hand, I was able to go ahead and reopen that and do that. So that's our continued commitment to do so, is when we do notice things like that. In the case of Dr. Key and Dr. Schaefer, we do take that moment to make sure that we're providing everybody the opportunity to make public comment on that front. So thank you for that reminder. All right, with that, I don't see any additional public comment for this, and I don't see any additional raised hands. And thank you for putting up the instructions. Madam Moderator, we'll go ahead and take up the next item. Item number 10.
I apologize for interrupting. This is the moderator. I do have a comment that asks, or a question that asks, can a comment be submitted in writing?
Okay, I must have missed that. Certainly the board takes written comments. I think we'll see in a few items from now that those public comments that are submitted to the board are included in our board packets and also then made public as well. So certainly, folks, if you do have a agenda item for which you do want to submit written comment, you can do so by emailing us at bopmail@dca.ca.gov. So yes, we do take written comment and have done so for this and previous meetings. You'll see some of those public comments that have been submitted in writing as a part of the board agenda, board of materials. So I'm going to turn this over to Dr. Harpsheets. Dr. Harpsheets, I'll defer to you also in terms of when folks take a break, as well as in terms of navigating this item number 10. So over to you, Dr. Harpsheets, our esteemed chair of the Licensure Committee.
Oh, thank you, Mr. Fu. Okay, well, we heard earlier about some updates on waivers. I would like to ask Ms. Chung if there's anything she would like to add to what was told to us earlier.
Thank you, Dr. Harpsheets. I'm going to provide a brief update regarding waivers that has changed or extended since the last board meeting. I just want to point out that there are 2 types of waivers. One type is issued and maintained by the Department of Consumer Affairs, or DCA in abbreviation. And then another one would be the 3 waivers that is provided by the board. These waivers can also be found on the board's website, which is the COVID-19 info page. So if you would like more details, or if you might need more something in writing to reference to, you may go to our website for more information. The links are provided on the memo as well. So the first one, extending time to satisfy examination requirements. This is a waiver that is maintained by the department, and it has been extended since the last board meeting. So this waiver will now apply to applications that are scheduled to expire between August 2nd, 2021 and September 30th, 2021. So this waiver will give them a one-time 6-month extension to take the exam, to take or retake the examination from their expiration date of their application. In-person face-to-face supervision. This is also a waiver maintained by the department, and it has been extended. This will allow the 1-hour face-to-face direct individual supervision to be conducted via HIPAA-compliant video or other appropriate telehealth means until August 31st. Because due to the COVID-19 pandemic and the changing nature of local indoor guidelines, so beginning on July 1st, 2021, the board is providing a 6-month grace period to allow this individual face-to-face direct supervision to be continued to conducted via a HIPAA-compliant video until January 1st, 2022. For any trainees that is going to use this means as to meet the face-to-face supervision requirements, please have them indicate that they're using this way on their weekly log. Supervised professional experience time limitation. This is a board issue waiver and has no change. This is just to provide a 6-month extension to accrue experience towards licensure. Psychological assistant 72-month registration limitation. This is again another waiver issued by the board. It provides a one-time 6-month extension for any psych assistant who has reached the 72-month limitation on or after March 4th. If any current psych assistant would need this extension, please write to us and then we will have you extended and processed. Extra time to complete continuing education requirements for license renewal. This is a waiver that is maintained and issued by the department. This waiver has been extended and this waiver will allow licensees to complete their renewal-related continuing education requirements by January 26, 2022 for a license that will expire between March 31st and September 30th. Reinstatement of licensure. This is another waiver that is maintained and issued by the department and has been extended. This will allow these reactivated or restored licenses pursuant to the waiver. Their validity will be extended until September 1st, 2021. CPLEE for restoration of licenses. This is a board-issued waiver and supplement the reinstatement of licensure DCA waiver to allow the licensees who are using that waiver doesn't have to take the CPLEE examination again. This concludes the update of the waiver, and I'll be available for any questions if you may have.
Ms. Chung, do you know if many people have used the reinstatement for inactive or canceled licensure and restoration of licenses? Have many people used that waiver?
I think we have about around 50 licensees that have used that waiver. But recently, I haven't been receiving any requests.
Okay, interesting. Okay, shall we open for public comment, Mr. Fu, on waivers after each of these items?
Certainly, I think for these items, maybe we can take up all yes, go ahead and take them up and group them together as appropriate.
Okay.
And then, or I understand that, well, because this is a new format for some folks with regard to the app. If they are having technical difficulties, to go ahead and say that, so that we can be able to at least try to make sure that we're providing folks the opportunity to make public comment. So if they're having, so I just would put that out as an option as well, if folks have are unable to access this for some reason, to be able to say that they have a technical difficulty, so we can assist them. But Dr. Harpsheets, back to you.
I'll ask for public comment after each item, but that if, for example, somebody's not able to get on right now for some reason, say about the waivers, let's just say if they can, under item C, they can talk about waivers then. So that way we make it as available as possible. So, Madam Moderator, could you open the box for public comment on waivers?
Yes, this is the moderator. I've opened up the Q&A, and I wanted to reference, there were a few comments that came in last time, and I believe there was clarification that to the prior question was they would like to know if you can write out a question in the Q&A box without having to speak. And they're referencing this live meeting.
Mr. Fu?
Thank you so much. So actually, Madam Moderator, first of all, we've been operating this way because I think it's under the guidance that we received. So perhaps this is a question for Ms. Joffrey. Is that something that we can do and allow for in terms of having a person submit their comment at this time in the meeting through the chat box?
That's actually a unique question. That's not come up. Certainly in the spirit of the act, that would be able to provide comment, especially if someone is not able to speak. So I would not be adverse to that, but because I've never heard of this before, that is a unique question. Also, I don't know if I believe there's an option to call in as well, but I would not be adverse to that. I think at this point, that would be up to you, Mr. President.
All right. Well, I love it when we want to have a little bit of discretion. So yes, certainly we want to make sure that folks who are having difficulty accessing audio to go ahead and be able to do that. So so if you're having difficulty to do so, please go ahead and type in your question if you prefer to do that. What I will do is that when the comment or question is typed in the chat box, I will read it aloud, or Dr. Harpsheets will read it aloud in this case, because we want to make sure that for our attendees who may not have access to visuals, that they can at least hear the conversation as well. So yes, definitely a comment can be typed in. One thing I will say is that there is a 512 character limit. So if your question exceeds that, it might be difficult, but we'll make it work. So Dr. Harpsheets, over to you to guide us through this process.
Okay, let's open the public comment box for any comments on the report on waivers.
This is the moderator. The Q&A is open. Members of the public, the instructions are displayed on the screen each time that public comment is requested. To make a public comment, please follow the steps again displayed on the screen. Click on the Q&A icon. It's typically located at the bottom right corner of your WebEx screen, and it's within a button, and there's a question mark inside a square, and then Q&A. And then an ask field will pop up once you open that, and it's a square, and within the square you'll type in comment, or I would like to make a comment, or as now indicated, you can type or write out your comment there as well. Make sure that it's being sent to all panelists, and click send. And afterwards, if you did request to make a public comment, we will send you, or I will send you, a request to unmute your microphone. It will pop up on your WebEx screen, and it's a little window as indicated or shown on the screen. It will say unmute yourself, and it says you are being asked to unmute yourself, and just simply click on the unmute me button there. And there is a comment in the Q&A. And I believe it's a request to speak, but if Board President, if you would like to read off the comment.
Sure. In this case, though, I'm gonna just have Dr. Harpsheet, since you're managing the public comment section for item number 10. I'm happy to read it, but we'll yield to you, Dr. Harpsheet, after this section. So there is a question about, has there been or will there be a waiver for the 5-year limit in exempt settings to accrue experience? So this is in reference to the 72-month question. So over to you, Dr. Harpsheet.
Okay, I'm still trying to find it here on my screen. So I'm sorry, trying to find it. Okay, is this from Melody Schaefer saying I'd like to share KPIC's concern, or is, I think that's the one that I see. I'd like to share KPIC's concern about the timing of approvals for supervision waiver. Is this the same one you see, Mr. Fu?
I do see that, but that is not the one I referenced. But we can take the one that by Dr. Schaefer first, and then go back to the question that was posed prior to that.
Okay.
And well, this will, because this is a new format and we're being flexible and adaptable, there will be moments when it won't be as smooth as possible, and that's gonna be okay. So we're gonna go to Dr. Schaefer's comment first, and then about KPIC's concern about the timing of approvals for supervision waiver. Over to you, Dr. Harpsheet.
Okay, Dr. Schaefer.
Yes, thank you. Not just for KPIC, California Psychology Internship Council, but also on the Division II Board of CPA, which is Education and Training. This issue has come up repeatedly of the angst that causes supervisors as the date approaches just 1 or 2 days prior to the termination of the approval for online supervision. And I'm wondering if there's any way that the board can work with the DCA to help that move forward, and whether there's any discussion of making it permanent in terms of supervision approval, online supervision approval.
You know, I'm going to ask Ms. Sorick to comment on your question, and hopefully she can provide some additional information.
Can you repeat the question one more time, Dr. Schaefer? I apologize.
Well,
I heard about supervision and...
Yes, online supervision. And so it's kind of like a two-parter. The first one is the board working with DCA, but because at the last meeting, it seemed like that was who you communicate with to get an extension on the waivers, allowing supervisors to supervise their supervisees doing telesupervision. And what typically happens is, of course, is it's just a day or two before the termination of the existing waiver before we hear that there's an extension, sometimes just the day before. This creates a great deal of angst among the psychologists that are supervising, because if the waiver doesn't come through in time and they don't have enough lead time, they are fearful of having to scramble and figure out what exactly they would be doing to provide the supervision, and not wanting to wait and see if approval comes post the termination of the current approval, because then they would be operating outside the waiver's date of termination. So it would put them possibly in some kind of situation that could bring them before the board as their concern. So whether that is the case or not, it's the point of the angst it causes. And is there any way to help make that happen sooner than right up against the deadline. A second issue was, and this is from the KPIC board and has been brought up to me repeatedly, and as chair of the KPIC board, I told the board I would bring it up at this meeting. They've brought it up for months now, of wanting to know whether the board, because they hear from all their constituents, all our constituents of community mental health centers and such, of whether the board would pursue having online supervision, telepsych supervision, approved as part of the regulations and not just during COVID. So those are two different parts, Ms. Soren. I hope I was clear. Thank you.
Absolutely. Thank you for that clarification. So on the first question, there are two waivers in place for face-to-face supervision. So there's the one that the department had extended, and that ends on August 31st. We, in anticipation of the prior waiver expiring, went ahead and pushed out the waiver on that until January 1, 2022. As it gets closer, but not 2 days before, we will reevaluate depending on what is going on with the pandemic and the emergency declaration, because we are able to review and consider our waivers given the authority under the emergency declaration. Once or if that emergency declaration ceases, the board would lose its authority to provide waivers to its licensees. So to the extent that we are still operating under the emergency declaration and have the authority, we will give ample time to our licensees to be able to prepare. That's my commitment. And not to speak on behalf of the board, but I believe the board would feel the same as far as being able to give people enough time to prepare and plan their practices accordingly and their supervision accordingly. The second part of your question is about our regulations dealing with face-to-face supervision, and that was part of the regulatory portion of the pathways to licensure. So step one is the statutory changes to the pathways to licensure, which is included in our sunset bill, SB 801, which we'll hear about later today. Once those changes are made in statute, we can then look to our regulations and make those changes. I think there is an opportunity to reevaluate the regulatory portion of our pathways to licensure, because I think as COVID has been presented to our stakeholders, some of the realities of the language that were approved by the board in 2018 may or may not be as relevant. However, I know that we did address the face-to-face supervision component, and that was not a part of the requirements that were approved by the board back at that time. So we will be taking a fresh look at the regulatory language once, and hopefully if the statutory changes are made through our sunset bill, and then we'll move forward with reevaluating the regulations based on kind of the reality of the situation we're living in 2021. So I hope that answers your question. And if not, please let me know.
Thank you, Ms. Sorick. Dr. Schaefer, does that answer your question? We can't hear.
Dr. Harpsheets, Dr. Schaefer did, but thank you, Ms. Sorick, as a response. So.
And Mr. Fu, could you read the questions that was submitted? I can't see it on my screen.
Sure, no worries. There was a question submitted and asked if there has been or will there be a waiver for the 5-year limit in exempt settings to accrue experience?
A 5-year limit in exempt settings.
So maybe I can try to address this one. This was from the board's this was from a prior statutory change, which aligned with the pathways to licensure, time limitations on getting experience and hours towards licensure. That is something that is in statute, and it applies to governmental bodies, educational institutions, exempt settings in particular. There has been no request by the board to waive that requirement. And that would be a policy call on behalf of the board to submit to the department if the board so chose to do so.
And I guess I would add that we do consider individual requests on a case-by-case basis. Okay. I don't see any other public comment.
Dr. Herbsheets, I just want to clarify, we do consider extensions, and Ms. Chung, correct me if I'm wrong, but that would be for the 60-month rule and the 72-month rule, but the 5-year limitation is kind of in the hands of the agency or the educational institution or government body, and that would not be something that would go before the board unless the board issued a waiver to waive that 5-year limitation requirement. Is that correct, Ms. Chung?
Yes, that's correct, Ms. Orrick. Thank you.
Oh, thank you so much for that clarification. Okay, let's move on to item 10B, the licensing report. And I would like to ask May to share with us these numbers. And before she starts, there in attachment A, you will see one change to the report that the licensure committee recommended. And that was breaking out under the enforcement section of the licensees revoked, the numbers of revoked licenses previously were combined, stayed revocations and no stay, and those are now separated out. So May, if you could lead us through the licensing report.
Thank you, Dr. Herbsheets. So at the licensure committee in July, we received feedbacks from the licensure committee regarding necessary changes to the licensing reports, and staff have made a few updates to the report. I will point out the new changes as I go through each attachment. On attachment, as Dr. Herbsheets stated, for revoked, we added no stay and stay under the enforcement column. And attachment B, it shows the application workload report for all 3 types of licensee and registration from February 2021 through July 2021. I want to highlight that there is a spike in psychological assistant initial application in July 2021. And the board have previously seen a similar trend in the past year with an increase in psychological assistant application in June, July, and August. And we speculate that most likely students are ready to be accruing hours as they graduate around this time. And attachment C, it provides an overview of the application received for all 3 types of license and registration, including notification received for a psychological assistant. And I just want to clarify, the notification for psychological assistant includes psychological assistant requests to add or change supervisor or service location. The application and notification received shows a slight decrease in application and notification for all 3 types of license and registration from June 2021, and staff has identified that it was due to technical error and recording, and currently we are working to mitigate the issue. For attachment D, it provides a 12-month period data of the total candidates and first-timers who have taken the EPPP or complete and the passing rates. Per feedbacks from the licensure committee, staff are working with the DCA data team to incorporate demographic information such as age, race, etc. for exam candidates. So the addition of the demographic information will be incorporated in the future examination statistic. Furthermore, we added a new attachment, which is attachment E. It provides a 6-month overview of the average application processing timeframes for the 3 types of license and registration. As you can see on each chart, you will see the average processing timeframes and days for each type of application request. While you're looking at the stats, I would like to note that we made a change to collecting data in a month instead of at the end of the month. So you'll see no data available for July due to the transition.
Okay. I just wanted to thank this new
Timeframe that.
Oh, I'm sorry.
Sorry, what was that?
You're cutting out. I'm not sure. I'm not hearing you.
Oh, okay. Can you hear me now?
Yes, yes.
Okay. Thank you about that, Dr. Harpsheet. Okay, so on attachment E, it shows the application processing timeframe for the 3 license type, the license type and the registration. So on July, there's no data because we made a transition to the time frame of when to collect the data. So we decided to collect the data at the beginning of the month instead of at the end of the month. So that's why there's no data available for July. These data for the application processing timeframes are accessible to the public on our website. The application processing timeframe that we post on our website are updated monthly. However, the data presentation on our website is different and such that on our website, we list the oldest received date of the application or request received instead of the average processing timeframe in days, as you see here on attachment E. At this time, I would like to hand the mic over to Stephanie, and she will continue with the rest of the licensing report.
Thank you, Ms. Song. Thank you for the wonderful report. I would like to add that regarding a breeze and Paperlike updates. So on June 16, 2021, we have did a soft launch regarding an enhanced functionality in our brief systems. So what does this new functionality do is to enable our licensure applicants to view their application status and any deficiencies that may have when they log into their profile in Breeze. So we hope that this enhancement will be act as an additional method to communicate to our licensure applicants, and we hope that these features will be able to provide them a way to check for their status through Breeze after logging into their profile. At the previous meeting, we have received comments about the ability to do the complete request, complete the law and ethics exams, applications, or to request for initial licensure online. So we did initiate conversation with our Breeze team, and then we'll include this in our future prioritization after we're able to complete all the configuration for this specific functionality. If we're looking at a timeline, so this going Paperlike enhancement is being pushed back currently because we have to work on a sunset implementation, and so we can prepare the Breeze system to be function for our new mandates. So the earliest that we could start working on this new functionality is planning to be in Q1 2022. And I also want to talk about the projects that are on hold. We have provided this update previously, but just want to mention it for informational purpose. So there are 2 projects currently that are on hold. The first one is to create content for the committee's review and consideration regarding the informational resources providing to supervisors that will cover the regulations and frequently asked question portion. The second is the co-host a stakeholder meeting with the Board of Behavioral Sciences and the Commissions on Teachers and Credentialing regarding the respective roles of licensed psychologists, licensed educational psychologists, and individuals holding the credential with a specialization in school psychology, how to best inform consumers regarding their roles. And to continue, I want to bring attention to page 55 through 57. The board has previously asked for the year-to-year comparison regarding the number of approved candidates versus the number of candidates who took the exam. So these statistics are provided on those pages. And thank you, Ms. Snyder, for providing this information. And we're happy to answer any questions if you may have. Thank you.
Thank you so much. Okay, I would like us to talk briefly about the continuing education and renewals report, and then take public comment on the licensing report we just heard and the continuing education and renewals report. So Lisa McCochran, if you could please provide information, walk us through what we have on that report.
Okay, thank you. Hi, I will be presenting the CE and renewals report. I just wanted to highlight a couple items. Audits for September 2020 through January 2021 were sent out this past July. I'm very excited to report that we are getting close to being caught up. I also wanted to highlight the CE waiver that states that licensees who expire between March 31st, 2020 through September 30th, 2021 are given until January 26, 2022 to fulfill the CE requirement. Licensees must still renew by their expiration date, and on their renewal, they must state the true amount of CEs accrued thus far. Once the 36 hours are fulfilled, the licensee is to keep record of their CE documentation for 4 years and will only need to furnish them to the board upon request. This concludes the CE and renewal report, and I'm available to answer any questions.
Okay, I just wanted to point out one thing on attachment A. The licensure committee thought it would be helpful to understand, since all probationers are audited annually or each time they renew their licenses. And so on attachment A, where it says total number of licensees selected for audit, we were hoping to see how many of those were probationers and how many of them were not on probation. So do you have that, Ms. McCochran?
Yes. So of the 326 licensees selected for audit, 41 of them were probationers.
Okay. And then I know you also, one of the questions we had was when people have not passed, we asked for that number to be broken out, which you did here. Was it that they actually didn't have the number of credits that they needed, or have they just not provided the information? So thank you for breaking that out for us.
Oh, yeah. So for the people who didn't pass, so those were the people who expired from January 2020 to March 30th, 2020, before the waiver was in place. They didn't pass because of they were short hours. And then after the waiver was in place, those who didn't pass were only failed because they did not respond to the audit.
Okay, that's good to know. That gives us a perspective. Okay, could we open the public comment box for these last two items, the licensing report and the continuing education and renewals report? Madam Moderator,
Madam Moderator, you may be muted.
we see the public comment box, but we don't hear you.
The moderator, are you able to hear me now?
Yes, thank you.
Thank you. And just to share a little tip, I did click unmute, and from my end, it did say it was unmuted. So when I went ahead and clicked on the audio options, which is the down-facing arrow on the mute button, and I just selected another microphone, and that resolved it. I don't know how many microphones my computer has, but I do see that Board President's hand is up. Sarah Fu, would you like to address the hand before moving on to public comment?
Oh, no, I can wait until after public comment, but thank you for noticing that. I appreciate it, Madam Moderator.
We also see Board Member Dr. Cervantes. Dr. Cervantes, would you like to speak prior to public comment?
I have a couple of questions. Whichever is easiest on the moderators.
Okay, go ahead.
Oh, okay. So in reviewing our packet here and the reports that were just presented, there's a lot of very useful data, and I want to thank Dr. Harbsheets for her leadership on the Licensure Committee and Ms. Chung. I'm struggling, though, from the data presented to understand or get a clearer sense of the impact of the pandemic over the last year and a half on our community of people who are applying for licensing or renewing, and the impact of the waivers on this population. And I know we have an item later on the agenda for that. So in the combined board packet, on page 55 for agenda item 10B, examination candidate statistics, I'm just trying to understand what we're seeing here. So there is a notable decrease in the number of folks taking the exams for licensure in the year 2020. And there's probably a lot of reasons for that, including the diminished capacity of the test-taking sites. So the venues had various limitations, restrictions because of the pandemic. Could you tell me, based on your experience and your analysis, it seems that there is a potential that there are several hundred individuals who applied for a license and are kind of like in some kind of holding pattern. That's what I'm inferring from the information here. And I'd like to know, based on from our team, Ms. Chung, is that the case? Do we know? Do we have an idea of if there are bottlenecks in the licensing process right now, where those may be, and if the waivers are helping with that or not helping with that? Do we have an idea?
Thank you. Yeah. Oh, yes. Sorry.
That's really my question.
Would you like me to respond to that, Ms. Cervantes? Dr. Cervantes? This
Yes.
is Ms. Chung. Oh, okay. Thank you. For the regarding your questions on bottleneck and the waivers usefulness, I think the applicants do find it helpful with their waivers because that would really allow them more time to make arrangement or to prepare for their to take or retake their examination, especially the one-time 6-month extension is our experience because we have been notifying them regarding the extension, and we have received positive feedback when they are notified as well. So in that case, we know for sure that it is having a positive impact in certain degree. And regarding bottleneck on our licensure process, because we have been right-sizing our budget, so we have been short-staffed, that would be the only possible impact that we would think that might lead to some bottleneck because we don't have the full capacity to process applications like before when we have more hands on deck. I hope this answered your questions.
So there are, according to the data that was provided, there was several hundred fewer people completing the exams. So I understand that that might be because of the diminished capacity of the testing sites, but do we know, did those people come back in 2021 to take the exam? Do we have the capacity to analyze that? Analyze what happened, because it's not like it's like a variation of like 50 people. It looks like it's several hundred. And I just think all of that, and we just might not have the mechanism to understand that what happened there, but all of that to me seems like it has implications for the waivers and how we are using our authority to keep people moving through into their license, and then into their professions. Do we have capacity to analyze those couple hundred folks who didn't finish their exams in 2020? Do we know what happened to them?
Hi, can you point out to where the several hundreds that you're referring to so I can be of better assistance?
On page 55 of our combined packet.
Okay. So I'm seeing if you're asking about year 2020 for the EHPP, that is the national exam, we have 1320 approved candidates. And then we have actually a little bit more candidates who have taken the exam in the same year, which shows 1354. And then regarding complete the law and ethics exam in the same year, we approved 1,086 candidates, and we see less candidates that actually taken the exam at 1,007 candidates.
So I guess it's really twofold. There are noticeably fewer candidates eligible for the exams and fewer who completed the exam. And so, like, what do we know about them compared to the year before?
So I'm going to step.
I think that, you know, what we saw was that it was more difficult for people to take the exams because of the limited testing facility availability. And but just to let you know, which we'll talk about soon, is that people who were in a position of, like, say, running up against the time limit to get these exams taken have requested extensions of the time, and our committee has taken those under consideration. And in item, what is it, item E, we will be talking about those. So I think that's probably what we're seeing is different.
So we don't, and it's, I don't want to belabor this. So we don't really have the capacity to understand the where and how this lower number, and I'm just looking at 2 years of data because that's what's in our packet.
Yeah.
We don't, I mean, if we don't have the capacity, then then that's fine. I just, the reason why I'm thinking about that and asking about that is because we have spent a lot of time on the waivers and what we need in the waivers and trying to be responsive to our constituency. And I just don't have, I'm trying to understand if we are in fact being as responsive as we could be.
I think at the first couple of paragraphs at the top of page 56 helps to give some idea of what was happening. And and I feel like our licensing unit has been pretty responsive to the situation that our applicants have found themselves in based on the pandemic considerations. And so I'm wondering if those couple paragraphs might help to answer your question, Dr. Cervantes.
It's helpful. I guess I'm just feeling like maybe we just don't have the capacity in our mechanism to understand if the folks came back and finished their licensing, and that's okay. It's just good to kind of just so we understand what this what is happening with this population. And I certainly appreciate, as we'll move on in our agenda, how unique the circumstances created by the pandemic are for people. So I certainly appreciate that.
Okay, thank you. I think Ms. Snyder would like to say something.
Dr. Harpsheets, actually, before we go to Ms. Snyder, may I make a remark in response to this?
Please, yes.
So one, just from a staff capacity perspective, the responsibilities of the licensure staff is to make sure that we're responsive to folks and applicants who are applying for licensure, and we process their paperwork and meeting those requirements. And so in terms of the data analysis required, that's certainly something that we can have a continuing conversation with the executive officer and Ms. Chung about. But I'm also mindful that the responsibility of the licensure staff is to make sure that we are processing the applications in a timely manner. We aren't currently presently asking people why they don't want to take an exam yet. And certainly in terms of any capacity questions or any considerations for those discussions, I would like to better understand and make the connection between how asking a person why they aren't taking an exam yet is linked to the responsibilities of the licensure staff to make sure that we are being responsive to folks who have applied and who are taking the exam. And then just the final point is that certainly I think access to care is incredibly important, and to the services for psychological services is crucial for consumer protection. And so to the extent which the board can certainly be helpful in understanding some of those drivers, but my perspective on this is that it's the licensing staff isn't really a case-working entity to be able to serve every person to get them through the entire process from an intensive supportive services perspective. Certainly the responsibility is to make sure that we provide and respond to questions from applicants about how to complete the process and get them through that process. but in terms of the intensive casework management to assist every applicant in getting them through career pathways, I think that's a separate function really for our limited team. And my suspicion is that it's the desire of in terms of prioritization, that we make sure that we're addressing the applicants' needs who are going through that process. So I'll just leave my remarks there and appreciate the opportunity to weigh in on that. And I know Ms. Snyder has something to say as well.
Okay, I would like to add to what you're saying. I think that what we have seen over this last year is our licensing unit make many changes to especially be available and accommodate those going through the licensing process through Breeze system enhancements that have been implemented, other ways in which people can check their applications, get information. So I would like to commend them and thank them for the work that they have done to be responsive to our applicants in that way. So Ms. Snyder.
Can you hear me?
Yes.
Okay. I just wanted to add that, okay, so the number of exams taken, you always have to look at this as the numbers reflect first-time applicants and retakes. So there's not always going to be a direct correlation with the number of approved candidates because that's largely because we don't control scheduling, exam scheduling. That's the applicant's responsibility. So even if the waivers were granted, it's really up to the candidates to schedule their exam. And based on my experience, I've had candidates immediately schedule on the day of approval. And then I have candidates scheduling 6 months after, and sometimes right at the end of their eligibility date. So when the waivers come up, some of them, they schedule right away, and some wait until the last minute to schedule their exam. So we can't control that. So it's really up to the candidates. It's their responsibility to schedule their exam and get licensed. And we help them along that process.
Oh, thank you. Thank you for that clarification, Ms. Snyder. Okay,
Sure.
Madam Moderator, if you could open the public comment box, and after we have public comments on these two items, if we could then take a 5-minute break before we come back and finish up the licensing report.
Oh, Dr. Harpsheets, just as we open up the public comment, I think the intention may be to go to lunch at 12:30 for a 30-minute break, and so
okay.
Do we have? Would it be possible for us to go until 12:30 and then take a 30-minute break then, or?
That's fine. Yeah, that's fine.
Okay.
No problem. Okay.
This is the moderator. The Q&A is open. Members of the public, the instructions are on the screen if you would like to participate. Click on the Q&A icon that's located at the bottom right corner of your WebEx screen. Type comment, or I would like to make a comment, or as indicated, you can actually type in your comment and submit it to all panelists. So click that send button. And I do have, give me just a moment to check the comments. And there's a comment, I apologize if I missed it. Would you like to read the comment in the Q&A box?
We covered that question,
Okay.
Madam Moderator, in the previous round. So we're good on that question there. And I don't see any written or desire for public comment. So we can go ahead and close public comment and return it back to Dr. Harpsheets.
Okay. We will take up item D, Item D is ASPPB has requested feedback from our board about the EPPP Part 2 skills. And the licensure committee reviewed the questions that they posed on their survey. And I will share our responses, and then we can talk about them as a board. And then if there's any public comment at the end of my going through each of the responses. So you will see in your packet, obviously we represent California. It's the board chairperson who would provide the actual response. So in question 3, would we be interested in optionally authorizing candidates to take the EPPP Part 2 if the candidate would like to do so. So that would be a situation where if it was not required in California and but the person would like to take it, would we be okay with them doing that? So we did not have a problem. We said, yes, we would be open to doing that. Now, do we have the authority to authorize them to take that? And we do not have that authority. The next question would be, if it's not required, would a change in our regulations be required? And we wrote yes, but the answer, a fuller answer is it's likely. Our regulations now refer to the EPPP. If the wording that ultimately ASPPB presented, which would refer to EPPP 1 and 2 as the full EPPP, that then could find us in a situation where we did not have to make a change in regulations. So that's kind of that's still up in the air. Question number 6, if it's not a requirement, could we include it in the candidate's file? No, we could not do that for 2 reasons. It's probably not an option in the Breeze system, but we also are not authorized to collect this data. If they met requirements in California, we issued them a license, but they did take EPPP Part 2, would it impact their licensure or future disciplinary action? We answered no to that because we see that as, if it's not a California requirement, it would be irrelevant to licensing in California. In number 9, would we be concerned if other jurisdictions optionally authorizes them to take it? And we felt like that really wasn't our business, so no. In number 10, it's not a concern, again, because it's not a requirement for licensure in California. In number 11, do we have any policies or rules about the EPPP that ASPP should consider when making a decision? And what we were thinking about there is how our regulations are worded and how EPPP might word their regulations. And that's what we were referring to in number 12, that it would be a matter of the final language and how it was referred to. So I went through that pretty quickly, but let me open it up to any board members who would like to comment on the licensure committee's perspectives on responses to this survey. Dr. Cervantes.
I have a question about on the survey, on the question about if we would like folks who want to take the exam to take the exam. My initial concern is that it might be confusing to folks about if it's even at the time when they're signing up for exams, if that it's required or optional or those types of things. And that makes me because we don't even have authority for it, it makes me not want to provide that option for the purposes of it might cause confusion. Does that make sense? I think I'm thinking about two things at the same time.
So are you saying that a person applying for a licensure in California, if they had the option, if ASPPB provided the option for them to take it and California did not have a problem with that, that it could be confusing for that applicant?
For that applicant, or even in our broader messaging about what is required for licensing, that's a primary concern that I have with this response to the survey.
I see.
There might be something I'm not thinking about. Might there be an opportunity for an applicant for a license that maybe, even though we don't require it, might an employer require it? And so because we suggest in the survey, and I recognize this doesn't bind us to anything, it's just a survey, but I guess what I'm trying to anticipate is that I don't want us to be in a position where we're sending mixed messaging to our constituency. Conversely, though, I'm also cognizant that this is a new exam, and maybe some employers would like for their licensees to have taken this exam, and I wouldn't want to be, I'd want to create an opportunity if that might be a requirement in the future from an employer or some other entity that might want a licensee to have access to this exam in the future, even if it wasn't required for the license. So if you could, I guess my first concern is really the mixed messaging, but I'm acknowledging I might not have thought about all the possibilities.
I think what we might more likely see is an applicant applying for licensure in California who recognizes that there may be a point in the future where they might like to apply for licensure in another state that does require the EPPP Part 2. And so they're thinking, well, this is the time I'm most prepared to take exams, so I'd like to be able to take that optionally now, even though, just in preparation for the future. But Dr. Matt Turner from ASPPB is available. And so, Dr. Turner, if you would be willing to maybe speak to Dr. Cervantes' question, that would be really helpful. Madam
Dr.
Moderator,
Harpsheets?
yes, I'm wondering if Madam Moderator could unmute Dr. Turner.
While Madam Moderator is doing that, Dr. Harpsheets, I would like to move that the board approve the suggested responses to the survey questions in attachment B.
Okay. Is there a second?
Hi, are you able to hear me now?
Oh, yes. Let us just finish. I will second it. Is it legit for me to second it as presenting it?
Yes, it's fine.
Okay. Okay. Yes, Dr. Turner, if you could share with us your perspective.
Yeah, thank you for allowing me to meet with you. I always appreciate the time to clarify anything. I listened to the answers to the questions, and I think you have a very good understanding of where we were going with this. To give you a little bit of background on this, as you know, some jurisdictions are adopting the Part 2 and some jurisdictions are not adopting the Part 2. And we received a request from one of our jurisdictions that was not adopting the Part 2, but they wanted to optionally allow candidates to take the Part 2 if they chose to do so, even though it is not required in that jurisdiction. And so we were not initially, our current policy does not allow for that. and let me backtrack a little bit also, is that if an employer would like them to take the Part 2, that would not be sufficient as well. In order to take the Part 2, your jurisdiction has to require the Part 2 and authorize you as an eligible candidate for the Part 2. And based on your responses, it sounds as if you wouldn't have the authority, almost as if somebody else would not have the authority to do the California laws exam. Like if I'm licensed in Nevada, I can't ask them to authorize me for the California laws exam. So we saw it as similar to that. And the rationale also was not only that it was not required, but there is some security considerations in that part of the reason that you have to be a candidate for licensure is limits the population who take that exam to people that actually need that exam. So for instance, if someone were looking to get content and distribute that in some way, if they're licensure candidates, it mitigates that risk, which as someone who is not in exams may seem offensive or may seem surprising, but I can assure you that that does happen. The other issue, we actually reviewed that, and if it were something that our members would like to do, if they felt like that was something that would be beneficial to their candidates, they were willing to take on that added security risk. But we wanted to make sure that we weren't creating something that would be problematic for some other jurisdictions. So jurisdictions that are requiring the Part 2 may have some rules of when someone could take the exam. So if they took it somewhere else at an earlier point in the process, that could potentially be something that we wanted to know, so we weren't causing someone to take the exam twice. And then there's also some legal considerations, meaning that if you are allowing someone to take an exam that measures skills, and that person potentially does not pass that exam, the scores automatically go back to the jurisdiction. And would that jurisdiction then, if they license somebody who didn't pass a skills exam, would they have any liability should a complaint come up with regards to competence or skills? So that's a little bit of the background, and we really just wanted your feedback to make sure that we weren't putting you in any kind of bind based on your rules. If I understood the way you answered them, it sounded like you didn't have the authority to even authorize that, which makes sense, and all the answers seem perfectly clear to me. So that's the background, and I'm happy to answer any questions on this.
Yeah, thank you, Dr. Turner. Yeah, we wouldn't even have the authority to collect the information.
Right.
So, yeah, so we wouldn't necessarily know whether or not someone took it and passed or failed. So, okay, thank you so much for clarifying. Dr. Cervantes, was that helpful?
Yeah, thank you.
Okay. I don't see any other board comment. Could we please open the comment box for public comment?
This is the moderator. I've opened up the Q&A. Members of the public, if you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen. Type, I would like to make a comment, or simply comment, or actually write out your comments and send it to all panelists. The instructions are on the screen for your reference. And I would like to also provide a reminder, or as I mentioned, if you can please send it to all panelists. You are able to send it to individual panelists, but that may impact their ability to see it or our ability to address your request. And I do have a comment. Oh, sorry. Board Member Harpsheets, if you would like to read the comment in the Q&A.
I am looking to see if I have that. I actually can't see that on my screen.
No worries, Dr. Harpsheet. I'm happy to read it for you.
Read that? Okay, thank you.
Sure. Person view test centers do not require proof of vaccination and only require masking. They don't provide information on indoor ventilation systems. With ongoing uncertainties regarding COVID, current increasing requirements for proof of vaccination for indoor activities in various counties and within higher educational settings, restricting in-person meetings, will the Board of Psychology promote person view proctored testing, as person view does not offer this option to sit safely for the test and test sooner?
Is this question, do you understand this to be about taking the exams on, what would you call it, online? Is that how you understand that?
It seems to me here the question, first of all, the board doesn't promote a vendor for any particular item in terms of, I mean, we certainly contract with a vendor, but we don't promote them. It's done through a competitive RFP process. But secondly, it looks like it's around proctor testing versus sitting safely for the test and testing sooner. That's all I have, unfortunately, from this written comment.
I can see it. I am not sure if the person who submitted this could just tell us a little bit more about what they mean by proctored testing and testing sooner or sitting safely. I'd like to be able to answer that. And I think Ms. Snyder could also share some perspective, because we definitely have looked at safety protocols in the testing. So if whoever submitted this, please.
Yes, they mentioned online proctor testing.
Okay, I'd like to ask Ms. Snyder, because we did address this, and if she could share with us that question or that perspective.
Can you hear me?
Yes.
Okay. For exam security reasons, we don't offer online testing. There are a lot of factors that we need to consider. The computer that's being used, is that computer secure? There's just a lot of security issues with that. So we don't offer online testing for the CPLE. ASPPB, I don't believe, offers online testing as well. I mean, if there is an issue as far as, you know, safety issues, I mean, they can submit a request for accommodation and request a private room setting. Private rooms are available as long as they provide an accommodation request to the board. They can also contact me if they want to discuss it further. My email address is lavinia.snyder@dca.ca.gov.
That's helpful, so that people are aware that they can request accommodations if they have particular concerns. Thank you for reminding us of that.
That's correct. Okay.
Dr. Harpsheet, I don't see any further public comments, so we can return this back to you.
Yes, Madam Moderator, if you could close the comment box. And we have a motion before the board. Ms. Proto, could you please call the roll for the vote?
Yes. Cervantes?
Aye.
Who?
Aye.
Harpsheets?
Aye.
Nystrom?
Aye.
Phillips?
Aye.
Bruscate?
Aye.
Rogers?
Aye.
Tate?
Aye.
Roll's complete.
Thank you. Okay, we will move on to the extension requests, and I will go through each one and summarize it, and you have the background information in your packets. And then we will take a motion for each one to accept or not the recommendation of the licensure committee. PSB 1 is requesting a 15-month extension for their 72 month. And the committee felt that 15 month was too long. There was the waiver that was extended their psych assistant license to September 30th. And we agreed that a 6-month extension would give them enough time to retake the EPPP. This person has, you could see the supporting documentation, but they have taken the exam twice and not passed. So we wanted to give the additional 6 months till March of next year, but not a full 15 months. Okay, are there any questions?
Move to adopt the Licensures Committee recommendation to grant a 6-month extension request beyond the 78th month limitation provided by the PSY 2002 waiver.
Okay.
Second.
Okay. Any discussion? Ms. Proto, could you call the roll?
Dr. Harpsheets, I believe we need to do public comment on each item.
One?
Let me double, if I recall correctly, Ms. Joffrey, that's correct, right? Before each
That
motion.
is correct.
Okay.
The motion, comment by the board, comment by the public, and then we can vote on the motion.
Okay. Okay, Madam Moderator, could you open the comment box for public comment on PSB1's request?
Yes, this is the moderator. The Q&A is now open. The instructions are on the screen for your reference. Simply click on the Q&A icon located at the bottom right corner of your WebEx screen. Type out or say, I would like to make a comment, or I have a written comment, and then type out your comments. And click send to all panelists.
Just a note, I'm seeing the comments in the section. I just want to make a point that while we are allowing for the written comments for these items to facilitate public comment, that it's really crucial that these comments are typed in when we open it up for public comment. So if you type it while you're hearing this discussion and you have thoughts and responses in the moment, we would suggest you type them separately. And when this screen opens up is when I would suggest you type in that public comment, or else you may not be able to align it in accordance with the discussion. And so as we lean into that format, that's just a request I would have, so for better tracking purposes. And Madam Moderator, we don't see any public comment for this PSB1, so we'll turn it back to Dr. Harpsheets.
Okay. Ms. Proto, could you please call the roll?
Yes, Cervantes,
Aye.
Fu,
Aye.
Harpsheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
Okay, PSB number 2. This person completed their hours in 2007, actually, has not taken the exam. They are requesting an 18-month extension. They did get the waiver, which gave them until February 17th of this year. And they, the committee felt that we had a concern that the person was considering a psychological assistant position as perhaps a career, and so voted to deny the request. Okay. Could someone make a motion?
So move.
I move to a board. Okay. Second.
Okay. Any comment from the board members? Okay, could we open for public comment?
The moderator, I'm opening up the Q&A for public comment. Members of the public, the instructions are on the screen. Simply click on the Q&A icon located at the bottom right corner of your WebEx screen. Type, "I would like to make a comment" or comment, and click Send to all panelists. If you like to write out your comment, please indicate that you have a written comment first and then write out your comment. Thank you.
I don't see any public comment. If you could please close the screen. And Ms. Proto, if you could please call the roll.
Cervantes,
Aye.
Fu,
Aye.
Harpsheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Could I also just ask who, I heard that Phillips seconded, but I did not hear who made the motion on this item.
Dr. Tate.
Thank you, Dr. Tate.
Okay, PSB number 3 took the exam in 2016, has not taken the exam since, and was requesting an extension of 12 months. The committee recognized that the person with the 6-month waiver has until November 30th of this year to continue to practice and to take the exam. And we asked the question of licensing staff, if they did apply at this point and took the exam and passed and then applied for the CAPLE and passed, was there enough time between now and when their expiration date is in November, at the end of November, for this person to get licensed? And they told us that yes, that is enough time. So we voted to recommend to the board to deny this request, the request by PSB number 3. But I have a motion from—
I move that we adopt the recommendation of the committee.
Ms. Nystrom seconds it.
Thank you. Any questions or comments from board members? Okay, let's open the screen for public comment.
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen and type comments or "I would like to make a comment" and send to all panelists. Again, if you would like to make a written comment, please indicate that first, "I have a written comment," and then indicate or write out your comment. Thank you.
Okay, I see no public comment. Could you please close the box, Madam Moderator? And Ms. Proto, could you call the roll, please?
Cervantes,
Aye.
Fu,
Aye.
Harpsheets,
Aye.
Nystrom,
Aye.
Phillips, Riscate,
Aye.
Rogers,
Aye.
Tate,
Aye.
repeating Phillips.
Aye.
Thank you.
Okay, motion passes. PSB number 4 requested a 12-month extension. This person has taken the exam and not passed 15 times. Came close in January of this year. This person has a current expiration date of January 6, 2022. The committee voted to recommend to the board a 6-month extension and versus the 12-month that was requested. Could I have a motion to approve the committee recommendation?
I move to adopt the 6-month extension.
I second. This is Shakanda Rogers.
Okay. Any questions from board members? Okay, could we open the public comment box?
This is the moderator. I'm opening up the Q&A. Members of the public, the Q&A is now open. If you would like to participate, please follow the instructions on your screen. Type or click on Q&A icon located at the bottom right corner of your WebEx screen, and then type, I would like to make a comment, or simply comment, and then hit send to all panelists. If you would like to write out your comment, please indicate so first. So say, I'd like to write out my comment or written comment, and then write out your comment. Thank you.
I see no public comment. You could please close the box. And Ms. Proto, could you please call the roll?
Cervantes,
Aye.
Fu,
Aye.
Sheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
Okay, motion passes. PSB number 5 requested a 12-month extension, has taken the EPPP 3 times and not passed. The current registration expired on June 13th of this year, and the committee voted to recommend to the board a 6-month extension from June 13th of this year. Could I have a motion, please?
So moved. This is
Second?
Nystrom, second.
Okay. Any board discussion? Okay, could we open the comment box for public comment?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the Q&A icon at the bottom right corner of your WebEx screen. Type, I would like to make a comment, or simply comment, and click send to all panelists. If you would like to write out your comment, please indicate so first. Write, I have a written comment, and then write out your comment. Thank you.
I see no public comment. Could we please close the box? And Ms. Proto, could you please call the roll?
Cervantes,
Aye.
Fu,
aye.
Sheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Okay. PSB number 6 took the EPPP in May of 2018, did not pass, indicated they are changing their study habits, and has requested a 12-month extension. The current registration expired in July of this year, and the committee is recommending to approve a 6-month extension. Could I?
Nystrom, I move to adopt the 6-month extension.
Okay.
I second. This is Shakanda Rogers.
Okay. Any board discussion?
Quick question. So on this one, since their registration expired in July, if they get a 6-month extension, does the 6 months start now, or is it 6 months from when their registration expired?
It's from when their registration expired, but I think that's a really important question because there's a lag time so often from when people submit these requests that one of the questions we had as a committee is if their registration expires during that time before there's an extension approved, they are told by our licensing unit that they are not to continue to practice during that time. So it's important for people, if they're going to request an extension, to do so early enough on and not find themselves in a situation where they're not able to provide continuity of care for their clients.
Okay. Okay. I was just curious.
Yeah. Thank you. Okay, I don't see any other hands, so could we please open for public comment?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. Members of the public, if you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen and type, "I would like to make a comment," or just comment and send it to all panelists. If you would like to write out your comment, please indicate that first. "I have a written comment," and then write out your comment. Thank you.
I see no public comments. Could we close the comment box? And Ms. Proto, could you please call the roll?
Cervantes,
Aye.
Fu,
Aye.
Harbsheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Okay, motion passes. PSB number 7 was requesting a 12-month extension. This applicant has passed the EPPP, and their most recent registration extension is October of this year. They have been cleared to take the CAPLE on, and they may have already taken it on August 1st, so they were able to take it. So the committee recognized that if we gave a 3-month extension, that should give this person plenty of time to get licensed. Could I have a motion?
Nystrom, I move the 3-month extension.
Second? I'll second it. Any board comments? Could we open the public comment box, please?
This is the moderator. The Q&A is now open. The instructions are now on the screen. If you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen. Type, "I would like to make a comment," or simply comment and send it to all panelists. If you'd like to write out your comments, please indicate, "I have a written comment," and then write out your comment. Thank you.
I see no public comment, so please close the screen. And Ms. Proto, if you could please call the roll.
Cervantes,
Aye.
Fu,
Aye.
Harbsheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
PSB number 8 has approved exam accommodations and has had difficulty scheduling the exam based on the accommodations needed. This person's registration expiration is November 2nd of this year, and the committee is recommending to the board that that we approve a 6-month extension. The note here is that there was a deficiency notice sent on April 15th of 2021 saying that no supervision agreement had been received, and as of July 16th, 2021, that had not been received. Let me ask Ms. Chung if that has been received as of this date.
Thank you, Dr. Harbsheets. It has no change to my best knowledge.
Okay, so while the committee was recommending that we approve an additional 6 months, the concern that we had was having this deficiency notice regarding a supervision agreement. Are there any board comments on that? The So would anyone like to make a motion that we move forward with the 6-month extension necessary due to these accommodations?
In the absence of the agreement?
Yes, in the that's what I'm asking. In the absence of the agreement.
Okay, thanks.
Dr. Phillips, was that a motion?
It most definitely was not a motion.
Okay, got it.
Someone could make the motion that the extension not be granted until the agreement is received.
So moved. Phillips.
Nystrom, second.
Okay. Okay, any other comments by the board? Okay, could we open the comment box, public comment?
Q&A is now, this is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on the Q&A icon located at the bottom right corner of your WebEx screen and type comment or I would like to make a comment and click send to all panelists. If you would like to write out your comment, simply state I have a written comment and write out your comment. Thank you.
I see no public comment. Please close the comment box, and Ms. Proto, if you could please call the roll.
Cervantes,
Aye.
Boo,
Aye.
Barb Sheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
Okay, PSB number 9 has taken the EPPP 3 times and not yet passed. The committee is recommending approving a 6-month extension. The request was for a 12-month, but we're recommending to approve a 6-month extension. The current expiration date is September 3rd of 2021. Would someone like to make a motion?
I make a motion to adopt the recommendation of the committee.
I'll second.
Any questions or comments by board members? Okay, could we open the public comment box?
This is the moderator. The Q&A is now open. The instructions are on the screen. Members of the public, if you would like to participate, click on the Q&A icon, type I would like to make a comment or write out your comment and click send to all panelists.
I see no public comment. So could we please close the box? And Ms. Proto, could you please call the roll?
Cervantes,
Aye.
Boo,
Aye.
Barb Sheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you. And can I confirm, did you second Dr. Tate in this particular item?
I don't think it was me.
Oh, can I please ask who it was?
Nystrom
What?
is happy to provide a second.
Okay. Nystrom.
Thank you.
Okay, PSB 10 requested a 12-month extension. This person's current registration expires January 10th of 2022. They took the EPPP in 2010, did not pass, and has not taken it since. The committee voted to recommend to the board that we deny this request based on not having shown a intention to move forward towards licensure. Would someone like to make a motion?
So moved. This is Dr. Tate.
Nystrom, second.
Okay, any comments from board members? None? Could we please open the public comment box?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. Members of the public, if you would like to participate, click on that Q&A icon located at the bottom right corner of your WebEx screen and type comment or I would like to make a comment and click send to all panelists. If you would like to write out your comment, please indicate I have a written comment and write out your comment and send to all panelists. Thank you.
Okay, I see no public comment. So could we please close the comment box, and Ms. Proto, if you could please call the roll.
Cervantes,
Aye.
Fu,
Aye.
Herbsheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
Okay, our last one is PSY number 1. This is a person who is licensed in another state since 2018, wanting to become licensed in California, needed to accrue an additional 312 hours and is prepared to do that in California, but needs the extension of 2 years and 4 months in order to allow her to accrue those hours in a timely manner. The committee voted to recommend to the board that we approve this person's request. Could we have a motion?
Nystrom, I move to approve the request.
I'll
Second.
second.
Great. Any
Can we get-
comments?
can we-
by-
Sorry,
Go
can we
ahead.
get a name for that second, please?
Is that Nystrom? No, I can't
I-
remember.
I think it was moved by Ms. Nystrom, but can I get a name for the second? Who made the second?
This is Shakanda Rogers.
Thank you, Dr. Rogers. So it was moved by Ms. Nystrom, seconded by Dr. Rogers. All right, back to you, Dr. Herbsheets.
Okay. Any board comments? Okay, seeing none, could we please open the public comment box?
This is the moderator. The Q&A is now open. The instructions are on the screen for your reference. If you would like to participate, click on that Q&A icon located at the bottom right corner of your WebEx screen. Type, I would like to make a comment, or type out your comment, and click send to all panelists.
Yeah, I see no public comment. Ms. Proto, could you please call the roll?
Cervantes,
Aye.
Fu,
Aye.
Herbsheets,
Aye.
Nystrom,
Aye.
Phillips,
Aye.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you.
Okay, that concludes the licensing report for this meeting. Thank you to everybody for being so patient with me on all these various details. Thank you.
Thank you, Dr. Herbsheets. All right, so I am overdue on my promise for lunch. So what we'll do is we will be in a lunch recess until 1:15 so that's 1:15 p.m., at which point we will return and take up item 13, the Telepsychology Committee report, and just want to make sure I read this, and possible action. We are taking that item out of order, cognizant that I suspect there'll be robust discussion, and we want to make sure we leave a lot of time for that. So upon our return at 1:15 we will take up item number 13 for that. So the board's in recess until 1:15 p.m.